Today, we'll be discussing the case of Jerri Nielsen. It's March 1999. Jerri is in bed reading up on some studies after a long day of work. She had been living at the South Pole for 4 months by this point, working as the only physician amongst 41 total personnel. As Jerri was reading, she subconsciously began feeling her chest. But after moving her hand around some more, she suddenly noticed something very strange. There was a lump the size of a marble on her breast, and she immediately took note of this. Jerri decided to check back on the lump in a month's time to see if it had gone away, but after a month had passed, the lump was still there. In fact, this time it was larger and shaped more irregular. Jerri subsequently got in contact with specialists over in America, and soon enough, absolute mayhem ensued. 2 self-performed biopsies and a risky emergency medical supply airdrop later, and things were not looking good. Jerri needed to be evacuated from the pole immediately, but with the harsh winter conditions, landing a plane at the pole during this time of the year was something that had never been done before in history. They were in a serious dilemma. Without Jerri being rescued from the pole, her chances of survival were slim to none, and they were running out of time to treat her. The Air Force soon needed to make the very difficult decision on whether they would risk doing a rescue to save Jerri, or if doing something like this would be far too dangerous for those involved. This case would go down in history as a first and probably one of the most unique medical situations, not just at the South Pole, but in the world. And you'll be shocked to see just everything Jerri would go through as she remained stuck in the South Pole for months with a growing malignant tumor. Majority of the research from this case comes from the book Icebound, One Woman's Incredible Battle for Survival at the South Pole. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. Alright, let's get into this case. Jerri Lynn Cahill was born on March 1st, 1952 to parents Laureen Cahill and Phil Cahill in Salem, Ohio. She was the eldest sibling to brother Scott, who was 2 years younger, and Eric, who was 6 years younger. And growing up, her family was extremely close, which remained true even in their later years. Jerri described having a great childhood. Growing up, she did a lot of fun activities, she had close friends, she was a good student, and she was naturally athletic. When she was 5 years old, she asked her parents if they could put her in gymnastics, and from then on, she would often go out in her front yard and just practice all types of gymnastics moves. This became something she continually did throughout the years. Whenever she would come home from school, she always found herself multitasking by doing acrobatics. For example, when doing homework, she would often read while in a handstand, and since childhood, she was nicknamed by her loved ones as Duffy, or Duff for short, as this nickname was, quote, Irish, sporty, and lively, which she stated were all characteristics that described her. When she was in high school, she was on the cheer team, she did track, and even while being an athlete, she still kept up with her grades. Growing up, Jerri lived in a ranch house in a rural area, just a few miles from Salem. Her home was at the end of a dirt road, and it was surrounded by dairy farms and forest. And so when she was in high school, she would often partake in both athletic and very daring activities in the area. To describe these activities, on the dangerous side, she jumped into a river from a train bridge, and she even hung on a bridge with one arm. But on a more safe side, she would often bike and jump on her trampoline. Whenever she would do these leisure activities of biking or trampolining, Jerri would daydream about her goals for the future. She really wanted to travel to the furthest places in the world. She had dreams of going to countries in Africa and even going to Antarctica because she was interested in learning about different cultures, and being from a small town in the States, she was interested in experiencing a society that was different from where she grew up. Jerri stated that she had always been drawn to civil rights and human rights and had these goals of making change to the world on a very large scale. At 17 years old, during her senior year in 1969, she was able to travel as an exchange student for a study abroad program in Sweden. And it was after this trip when she truly realized that she shouldn't feel like she had to make huge changes to the world that were out of her reach, but rather if she worked on little things that would leave a positive impact on people's lives on a daily basis, this in itself would have a tremendous impact on the world. Having this mindset and having an overall thrill for high-risk situations definitely played a role in choosing her future career as an emergency medicine physician. Her curiosity for the world was something she attributed to her mother, Lorene, who she considered her role model. Growing up, Lorene had dreams of becoming a doctor, but being a woman from a middle-class family in the 1940s, this was something that wasn't feasible for her at the time. So at first, she became a nurse, and then she went back to school to become a psychologist when Jerri was 12 years old. Jerri's father, Phil, on the other hand, was a carpenter who grew up poor, but eventually became the owner of a construction company. The house they lived in was actually one that was built by her father, and she, but mainly her younger brothers, were taught the trade while he was doing this. They built it in the middle of a forest with large picture windows on all sides, so they could have views of the forest with the bright light shining through, and the home was decorated by Jerri's mother. Her father was nicknamed Lookout Cahill because he was very cautious and warned the family to always be careful, and this cautiousness was a trait Jerri would pick up herself. Both of Jerri's parents believed in the value of hard work, and this was a principle and characteristic that stuck with the family for all their years. After Jerri got back from her study abroad in Sweden, she applied and was accepted to attend Ohio University in Athens, Ohio. This was a big change for her. She grew up in the country, essentially in the middle of nowhere, and now she was in this much larger city than what she was used to with so many different people. But this move was one she described she needed. Although she stated that her teenage years were enjoyable and that they were good years, she felt that she didn't necessarily fit in anywhere as a teen, and she described how her trip to Sweden helped her realize how much she wasn't a fan of how society was in America. She felt as though it was superficial and that there were expectations placed on young women to live in an old-fashioned way as opposed to being able to pursue what they wanted in life or in their career. And this contributed more to her wanting to explore the world and go to these faraway places like Antarctica. Despite having fear of the sight of blood as a child, she always found herself helping others, whether it be wounded animals in the forest or other kids who got hurt while playing. So studying to become an emergency medicine physician was something that was up her alley. In 1975, at 23 years old, she started medical school at the Medical College of Ohio, or MCO, in Toledo. Today, this is now known as the University of Toledo Medical School. While things were going amazingly for her and she felt she was where she wanted to be, it was also during this time in medical school when she had gotten into a very bad accident, and her trajectory in life was changed in many ways. She was rear-ended in her Volkswagen Beetle while on her way to her very first clinical experience at a local hospital, and the person who actually rear-ended her was an ophthalmologist who worked at the hospital she was on her way to. MRIs were very new at the time, so a lot of hospitals didn't have them, and because of this, it would be only 13 years later when a neurologist noticed she was holding her neck in an odd position when Jerri would learn that from that crash, she had suffered 4 ruptured discs which were pressing on her spinal cord. They soon did an operation to correct this. But for those years before she received the diagnosis, her balance was bad, she couldn't dance or do the gymnastics moves she once did daily, and she had no explanation as to why this was happening, as doctors told her they couldn't find anything wrong. But Jerri described that she learned from this, quote, "The accident that debilitated my body humbled me at a very important time, right when I began medical training. I learned that a person could lose everything in an instant. It made me realize that all these people who were sick or hurt weren't that way because they hadn't tried hard or willed themselves to be better. It was that they'd had bad luck. Just within that year after she got into the accident, at 23 years old, Jerri met a man named Jerri Nielsen. He was a medical student as well, and it was just 3 months of knowing each other when Jay had proposed to her and Jerri said yes. They would go on to have 3 children, a daughter and 2 sons. At some point, as her children were growing up, Jerri stopped working as an ER physician to instead work as a family medicine physician so she would be able to spend more time with her kids. However, despite building this family, Jerri claimed that it took her several years to realize that she was allegedly in an abusive relationship. She alleged that Jay was emotionally and psychologically abusive to her and the children, and she further alleged that he was even physically abusive to the boys. Just clarifying regarding her kids and ex-husband, this is everything stated from Jerri's point of view and not her kids nor ex-husband, but it plays a role in a lot of elements that happened in this story. Jerri claimed that for a while, she made multiple attempts to escape the relationship, but after no luck, she came up with a very elaborate plan to convince her husband to divorce her. This plan was for her to have an affair so her husband wouldn't want to be with her anymore, and it actually worked. In 1998, they divorced and he had plans to move away with the kids. Now, Jerri stated that her lawyer suggested not fighting for custody over the children, but rather to co-parent to avoid any further turmoil. So she followed through with this advice. However, she claimed that in doing this, her ex-husband allegedly was able to manipulate the children to resent her. With the kids now being teenagers, Jerri finally accepted a job as an emergency medicine physician at a major teaching hospital in Cleveland, close to her parents' home. She said that initially her children agreed to move with her, but her ex-husband convinced the children to stay with him. Jerri decided to follow through with her lawyer's advice of not fighting it so that she doesn't make it worse for the kids with a traumatic court battle, but she agreed to this as long as she was allowed to visit every weekend. Though they initially agreed to this, she claimed that soon enough, the manipulation had gotten so bad, she was not welcome to visit or even to call. Jerri stated, quote, "I had stayed in a terrible, suffocating marriage for 23 years and lost everything by the time I saw that losing was inevitable. In the end, I lost my self-respect, almost lost hope. Like an animal in a leg hold trap, I gnawed away at parts of myself to escape. I survived, got a divorce, but I lost my 3 children in the process, and that is something that still seems impossible to me." Jerri ended up moving back in with her parents, and she had hopes that this new job in Cleveland would be able to fill the void in her heart from the strained relationship with her children. But unfortunately, this was not the case. While she enjoyed working with patients, she was having a hard time wrapping her head around the, quote, assembled line mentality she described was present in commercial medicine. She really was going through a rough period in her life and feeling very down. That was, however, until one morning when she came across an article that would give her a glimpse of a little hope in life. One morning, Jerri had been flipping through the mail that her mother brought inside. As usual, most of these letters consisted of bills and journals. But as she was flipping through, there was one letter in particular that immediately caught her eye. It was from the Annals of Emergency Medicine Journal, and it read, quote, "Polar Medicine, Physicians Needed for U.S. Antarctic Program." This was a medical journal that usually did have job postings on the back of it, but this job posting was one that particularly caught Jerri's interest. They were looking for a physician who would be able to work for 1 year at one of the 3 American bases they had stationed at Antarctica, specifically in the South Pole. This opportunity really excited Jerri, and it didn't take long for her to get her CV ready and fax a copy to the office of the Antarctic Support Associates, or ASA, located in Englewood, Colorado, a suburb just about 10 kilometers or 6 miles from Denver, Colorado. Soon enough, she had several calls and in-person interviews with Norman Wolf, the medical recruiter for the ASA, and Mike Masterman, the winter site manager at the South Pole, discussing the position. Antarctica is a place that's not owned by anybody or any country. Instead, it's governed by a group of different countries as part of an international partnership. On December 1st, 1959, the Antarctic Treaty was first signed, designating Antarctica as a continent intended to be used mainly for science, but also for different purposes, such as tourism, for example. Antarctica is approximately 1.5 times the size of the US, and about 98% of the continent is covered in ice. In Antarctica, the US has 2 research vessels used for scientific purposes. Likewise, the US also has 3 land-based research stations in Antarctica. There's McMurdo Station on the western coast, Palmer Station on the Anvers Island, and the Amunsden-Scott South Pole Station, where Jerri would be assigned. Jerri would be spending an entire year at the South Pole of Antarctica, a place they made sure to tell her was, quote, the coldest, highest, driest, and windiest continent on Earth. And they were absolutely not joking about that. In Antarctica, they have summer and they have winter. Summer was from October to February, and it would be during then when supply flights would happen to bring supplies to the residents. But it being called summer did not make it an actual summer. It was still bitterly cold with harsh winds, just not as cold and windy as it was in winter. But on top of that, what truly stood out about the pole was the fact that in the summer, they had daylight for 24 hours a day, 7 days a week. Whereas in the winter, it was the opposite, where they had darkness 24/7. So for 6 months straight, it's only sunlight. And then for the next 6 months, all darkness. There was only 1 day per year in the pole where they would have sunrise and only 1 day where they would have sunset. Otherwise, it was either always bright or always dark, no in between. Because of the lack of night and day, the pole operated on New Zealand time during the summer, as that's when the supply flights would be coming in from there. And when winter came, they switched to US Mountain Time to be on the same schedule as the ASA over in Denver. Not only were the weather and time different, but the working conditions were as well. During the winter, out of the 41 scientists and support staff there, Jerri would be the only one who was a physician. The pay would not be as good, and what Jerri had been reading, according to papers that covered previous South Pole doctors, she'd only be seeing an average of 3 patients per week at the pole, which is a stark contrast to her usual multiple patients in the ER. Also, and possibly the most concerning aspect of all of this, the weather conditions during winter at the pole were so bad that it would be during those 6 months when absolutely no flights were allowed to come into the pole or come out. They would have to be stuck there for the entirety of the winter, no matter what happened. Jerri thought long and hard about how going might affect her career, but more importantly, she thought about how it would affect her relationship with her children. While her parents and brothers were concerned, the majority of them thought that this would be good for her. But at the end of the day, she said that the opinions that took full priority to her were her children's. So she asked her children, hey, what do you think of me going to the pole? And told them if there's any opportunity that if I don't go and we can build our relationship again, I 100% will not go. But unfortunately, her children replied that this would not be possible whatsoever. So shortly after, Jerri called Norman Wolf over in Denver and accepted this position. In late October, Jerri flew back to Denver in order to complete a required physical before her big trip to the pole. She did a bunch of different lab tests, an EKG, a cardiac stress test, a psychological screening, and she even did a mammogram. As expected, everything came back fine. She only had one dental issue, a dead tooth, which they fixed with a root canal. While Jerri only was a trained physician, she was going to be the only medical professional at the pole, period. There would be no dentists, no nurses, no pharmacists, no lab technicians, no psychologists, no phlebotomists, no specialists, nothing. Every single health-related thing you could possibly think of was Jerri's responsibility. So as part of her preparation, she spent time being trained by dentists and other specialists because she would have to do everything from putting in IVs for people, practicing dental techniques, stocking the equipment, even manually lab testing blood work herself. With less than a month to go before the trip, Jerri was able to take her emergency medicine board recertification, get a power of attorney, and she successfully packed to spend an entire year at the pole. She was advised by the winter site manager, Mike Masterman, and Dr. Will Silva, the South Pole doctor she'd be taking place of, to pack lightly and just necessities, which included medical equipment and some forms of entertainment. As part of this, Jerri, fun fact, decided to pack a Celtic harp. But while she was fully ready to get on with this trip, it would be during that final month when she discovered news that would almost completely put this trip to a halt. Jerri's father, who was 70 years old at the time, had unfortunately been diagnosed with prostate cancer, and during a biopsy and an operation, he had lost so much blood that he went into shock and became extremely ill. Jerri had 4 days before she had to leave for the pole, and she didn't want to go anymore. She wanted to stay with her family as her dad recovered in the hospital. But even with how bad his condition was, he himself told Jerri, "Don't stay home because of me. You made a commitment to care for the people there. You have to go." Reluctantly, Jerri listened to her father and held true to the commitment she made to medically take care of the people at the pole. Soon enough, she boarded that plane at the Denver International Airport to begin her long journey to the pole. For this trip, Jerri flew from Denver to LA to Auckland, New Zealand to Christchurch, New Zealand. And from there, she was going to be going from Christchurch to a city in Antarctica called McMurdo, also known as Mactown, before finally getting on a flight to go from McMurdo to the South Pole. While in New Zealand, she was given her extreme cold weather gear, aka ECW gear, from the Clothing Distribution Center, and it was also there where she learned more information about the trip. They watched a movie with information on how to survive Antarctica, and there were some pretty interesting pointers in this movie. For one, they would only be allowed to do a 2-minute Navy shower. Not only this, but they were only allowed to take two 2-minute showers per week. Also, it wasn't going to be a normal commercial plane that brought them to Antarctica, but rather they would be brought in a cargo plane called the LC-130 Hercules for the entire 8-hour flight. And it would be during this flight where they would have to wear their ECWs in case there was an emergency and they had to crash land in the blistering cold. On the day of, once they were loaded up on the cargo plane and finally took off to McMurdo, unfortunately, as they were halfway into their flight, they had to turn back because the weather conditions were too dangerous to fly in. This action of turning back to their original location was a term they referred to in Antarctic aviation as being boomeranged. While this did suck, it actually worked in Jerri's favor because she'd realized halfway into the flight that she had forgotten vaccines that she packed from Denver in the fridge at the Clothing Distribution Center, so turning back allowed her to go collect them. Finally, though, after waiting for a week in Christchurch for the weather to clear up, they were able to get back on their trip to McMurdo, and after spending a brief period there, they got back on the plane to head 1,000 miles or 1,600 kilometers to the South Pole. Immediately when they landed and she exited the plane, Jerri felt the harsh weather conditions, and what was probably the most difficult for her was the fact that the South Pole is located at an extremely high altitude. It's about 9,300 feet or 2,800 meters above sea level, and because of this high altitude she was now in, Jerri described feeling, quote, lightheaded, lead-footed, and slightly nauseated. She further said that her legs were burning, and she felt as though she were on a different planet. Still, while wearing her 20 to 30 pounds of clothing and feeling like this, she had to carry all of her heavy bags along the pathway to get to the indoor buildings of the pole. When Jerri arrived inside, she was met by the manager, Mike Masterman, and the doctor she was replacing, Dr. Will Silva, and they gave her a tour of the infamous South Pole Geodesic Dome. After checking out the dome, Jerri went on to take a tour of the Biomed building. This was a small orange insulated shack that branched off of the dome, and this is where Jerri was going to be staying during her time there. This biomed building housed her living area and was also where the hospital was located at the station. And while it was a small hospital with little equipment, Jerri described her living quarters as rather luxurious and private compared to the other living arrangements people had at the base. She had her own bed, dresser, humidifier, bookcases, computer, and several wall hooks to hang up her clothing for the cold weather and skis. But while her living area was nice, the conditions of the dome as a whole were not. This dome was a building dedicated to the pole in January of 1975. It was initially meant to house 33 people during the summers and just 18 people during the winters, and it was initially designed to last just 10 years with a maximum of 15 years. But 23 years later, during the time Jerri was there, the dome was still standing, and this time it was housing more people than they'd ever seen at the pole at a time. Because there were 41 people there, consisting of 32 men and 9 women who were going to be staying over the winter. They were in the midst of assembling a new building to be ready within the next few years. So because of this, any problem with the current building they were in was essentially neglected because the mindset was there's no point in fixing it if they were going to be getting rid of it anyway. Jerri described that the outside of the dome was beautiful. However, the inside was, quote, appalling with worse air than an LA freeway during rush hour. By the way, the purpose of the dome wasn't to protect against the cold because it was actually just as cold inside the dome as it was outside. The main purpose was truly just to protect against the wind. What they instead had were these insulated orange shacks that people stayed in to keep warm, like the one the biomed building was in. Due to the new building they were trying to assemble, the primary thing that was being shipped over to the pole at the time were materials to construct the new building. And anything else that wasn't used for constructing the new building was considered secondary in importance, even including the fuel to power the station during winter. For communication, the pole had an all-call system which allowed people to make calls to each other directly or even make announcements to the entire station. To communicate with those back home, they used emails via the internet. Additionally, they used AOL Instant Messenger for real-time texting, and only available every Sunday, they used a special voice-only satellite before they were eventually shipped special phones that were able to be used through the internet. For the first few days there, Jerri was trained by Dr. Will Silva on every important thing she'd need to know practicing medicine at the pole, and eventually, when he did leave, she got training from other doctors from McMurdo who came down to the pole for a few days. There was a lot to learn and very little to work with. A lot of the equipment at the pole were outdated or didn't work that well in the conditions they were in. So finding alternatives was a common practice at the pole. Aside from the medicine, in general, people at the pole had a mantra of using less but giving more. So recycling and finding use in every single item they had was common practice. For example, at the pole, they only flushed the toilet when needed. Otherwise, if they had to pee, they would do it in an old bottle, like an empty peanut butter jar, for example, to then empty it into a pee barrel. For a lot of medications, if a patient didn't finish theirs out, Jerri would ask for them back so that it could be used in case another patient needed it. For example, she traded a pillow to a guy so that she could get back the rest of his cough syrup. This was something Jerri called a continent-wide black market for essential goods. The most common illnesses at the pole included frostbite, which for most was usually self-treated. But there was also respiratory infections, people would have gastrointestinal problems, and work injuries from construction. There were also concerns of hypoxia and hypothermia, but due to these not being studied too in-depth at the pole at the time, Jerri eventually ended up forming something called the Antarctic Medical Association, which was a database containing information of stats that medical officers at Antarctica had compiled all in one place. By the way, something that is of note is that people staying at the pole refer to themselves as polies. Initially, Jerri was under the impression that she would be seeing far less patients daily, but during the summer months, there were about 150 polies, so this left Jerri seeing approximately 15 patients per day. As Dr. Silva prepared to leave and Jerri was alone to run the pole hospital, she was taken back by the tremendous workload she had. She described, quote, "I felt I had been misled about the workload and about the nature of the job. It was so much more than I had expected, and it never ever ended." She was on call 24 hours a day, 7 days a week. Her first day on the job started early in the morning and quite literally ended at 11 p.m. Other police also felt that their workload was extremely high, and it also didn't help that in addition to being overworked, it was always bright in the summer, so a lot of them were unable to get adequate sleep. Jerri's first medical emergency case actually resulted in somebody having to be taken from the pole back to New Zealand. And just a few weeks into her stay, her hospital went from being named Club Med to being called the Hard Truth Medical Center, simply due to Jerri's straightforwardness with patients regarding their questionable choices. For example, telling a patient they were drinking too much alcohol, and that's why they were feeling bad. On January 7th, 1999, everyone at the pole received an email from the South Pole area manager titled Media Guidance. In this email, they informed the poles of journalists coming to the pole from 5 different media organizations to report on science while also getting more personal stories of people's experiences. And they instructed the poles on how to act regarding the media. Jerri, however, wanted no parts of media attention, as she had concerns that the attention could possibly rile up jealousy in her ex-husband. And so she avoided the reporters at all costs. Once February came, they officially closed the 3-meter wide and 5-meter high wooden doors of the dome to protect it from the winter weather, and they turned on the several light bulbs placed throughout the dome, as these were now the only source of light. But on Thursday, February 4th, as they looked through their inventory to make sure they had everything for winter, they noticed one huge problem. As mentioned, a lot of the things being brought to the pole were brought for construction. So when the police looked through their inventory, they noticed that they didn't have enough stockpiled fuel to last for the winter, as this was something that the ASA in Denver had neglected sending. February 15th was when all of the summer people left the pole, but by that point, the ASA would have needed to send 41 tanker aircrafts filled solely with fuel just for the police to survive the winter. With how unrealistic that sounded, everyone at the pole was extremely worried. But fortunately, just 4 days after the station closed, the ASA began sending 5 flights every single day until the fuel stores were replenished. Not only were they going to be sending more fuel, but they were also going to be sending the last flight of supplies that Jerri needed to run her medical practice. This most notably included X-ray film, as they were running low, pathology stains as they were out of date, and contraceptives. Unfortunately though, just as they were hopeful, they were hit with another curveball. It was about -50 degrees Fahrenheit or -45 degrees Celsius outside, and because of how cold the weather was getting, the last 2 aircrafts they sent to the pole actually got damaged. After this happened, the McMurdo doctor, Hugh Cohen, contacted Jerri and asked her, hey, what are the things you need most critically? Because they wanted to make sure if they were going to be sending one last flight to the pole, that the last flight had all the medical necessities. So for this last supply order, they included the requested medical supplies, as well as the last of the personal mail and some legal basic needs like cigarettes to avoid withdrawal. This should have been the last supply order of the season, and this flight did in fact take off. Big problem though. The weather actually got so bad as they were flying that they had to be boomeranged, and the winter police were soon informed that no further flights would occur at the pole until 6 months later in October, when winter was over. And as they had been doing, they were going to have to make do with what they had. Winter at the South Pole was described as being something that somebody winters, and the polies there specifically were described as being winter overs. So Jerri being there during the winter meant she was a winter over who was going to winter at the pole. I hope that made sense. By the end of that month, in February, all 41 of the winter overs had moved either into the dome or the elevated dorm in the suburbs. Inside the dome was now about -55 degrees Fahrenheit or -48 Celsius, so they had to wear their ECWs just to walk between the inner insulated buildings. While everyone continued their normal duties, it was also around this time when Jerri herself experienced her first illness since being at the pole. She had a fever and was fatigued, and she believed she had bronchitis. She reasoned that this was an infection that must have been brewing for a while based on the fact that they'd all been around each other for so long and shouldn't have had any new diseases introduced into their little pole bubble. And almost in a very foreshadowing moment, around this time, Jerri left medical books out in her office, and she even wrote all of the dosages and uses of medications on their boxes in the hospital, just in case there was ever a scenario where something emergent happened to her and she was either not alive or not well enough to work. Especially because there were some concerns Jerri had regarding the overall health of the winter overs. Specifically, she was worried about a condition called toastiness. This was a condition that had developed for many people at the pole as the weeks went on, with Jerri describing it as a, quote, documented syndrome characterized by social withdrawal, staring into space, memory loss, and attention deficit. Toastiness is also referred to as winter over syndrome. Jerri had read about this condition in the Navy Polar's Manual and stated, quote, the Navy thought it was caused by a constant lack of intellectual stimulation and sensory deprivation. Toastiness affects some more severely than others, and at the pole, symptoms of this would typically appear in August. However, with this winter over crew, it began much earlier, with people showing some significant signs in January. This, for example, included feeling uncomfortable around those who weren't polies. These symptoms were ones that could last even months after returning to the world, which is why it was common for a lot of the polies to stay in the New Zealand hotel for months after they left the ice, and some even would go explore on a random trip away from others. To try combating toastiness, the polies made an effort to stay as active as possible and come up with entertainment methods, including games or crafts, and even have weekly events each day to stay stimulated. On March 1st, Jerri even celebrated her 47th birthday with her fellow polies. For the first time in a while, Jerri was feeling happy again with this community she was very bonded with. But while she was enjoying her life at the pole and the friendships she's made, she would soon discover something that would absolutely turn everything around. One night in early March, around 12 a.m., Jerri had been sitting in bed with a book, reading up on some research regarding a patient's case. Now, while reading, she was just mindlessly rubbing her right breast. But as she was doing this, she suddenly noticed that she felt something off, because right on the surface of her right breast, she felt a small, hard lump. Now, something about Jerri was that she had fibrocystic breasts. These are breasts that are, quote, composed of tissue that feel lumpy or rope-like in texture. And this was actually something that ran in her family. So having small lumps wasn't new to her. Her mother, too, had the same condition and had even done biopsies for benign masses. And Jerri had experienced lumps before that would usually go away whenever she started menstruating. So after this lump, she just felt around the area, just trying to determine not only its size, but try to figure out if this was just one of the usual lumps she had. By the way, the words lump and mass are often used interchangeably in general, and they are also both terms that are used in Jerri's book. According to a fine needle aspiration specialist, Dr. Selena Nadelman, lumps are defined as any noticeable bump or swelling under the skin, varying widely in size and consistency. Masses are generally larger formations that can be benign, meaning non-cancerous, or malignant, meaning cancerous, necessitating further medical evaluation to determine their nature. So essentially, lumps are a more general term that can refer to something like a cyst, for example, which is typically benign, and a mass is another type of lump where there's abnormal growth of cells, which can be either benign or malignant. I'll be using both terms in this video as they were both used in the book, but I just thought it would be important to note the difference between the terms. If you remember, 6 months prior, before leaving the pole, Jerri did a mammogram and this was negative for breast cancer. While this did make her feel more hopeful, at the same time, if this was actually cancer, with it being winter at the pole and with the last plane quite literally leaving only just a few weeks ago, she knew that there would be nothing they'd be able to do about it at that point. The lump was just about the size of a marble, so Jerri just said, you know what? I'm going to keep an eye on this lump for the next few weeks. If it's still here or if there's any changes in a month's time, I'll proceed accordingly. Although March went on as usual, during early March, there was kind of a string of bad luck at the poll, one the police would call the disaster of the week at poll. There were a bunch of work-related injuries, including one that involved Jerri's best friend there, a man named Big John, who had a very bad fall from a roof. There was also a glycol leak that they called the glycol ghoul, which left everybody feeling nervous. The weather was also getting too cold too quickly and reached record-breaking coldness for the time, hovering around -90 degrees Fahrenheit or -68 Celsius. It got so cold so fast, it quite literally made the ground of the dome crack and caused very loud booming noises inside. As mentioned, Jerri planned to assess her breast again in a month's time. So once April came around, she again observed the area to see if the lump was gone or not. Her period had passed, so if this lump was anything like the ones she's experienced before with fibrocystic breast, the lump should have been gone by now. Unfortunately though, upon her assessment, the lump was not gone. It was still there. In fact, it had grown slightly bigger and more irregular. Additionally, it wasn't just one lump anymore, because as Jerri felt around, she soon discovered there was another lump growing right below the initial one. Jerri tried to stay calm at that moment. She didn't want to make this a big deal, and she wanted to wait it out before telling anyone because she knew, regardless of the outcome, with it being winter at the pole, there was nothing that could be done to get her out of the situation. No medications, rescues, nothing. She also knew that there was a possibility the lump could be a cyst or even something benign. So she wanted to give it some time to truly see if there would be any changes rather than cause false alarms and have everyone worried for something that could be potentially harmless. That being said, she was fully aware that cancer could be a possibility, but she didn't want to imagine that as a reality, stating, quote, "I wasn't prepared to believe that yet, and I didn't want to raise the alarm by telling anyone at the poll." Since arriving at the poll, Jerri had been in contact with her friend, a physician named Dr. Jerri Nielsen. Dr. Nielsen was a radiologist Jerri had met in the ER during her start as an ER physician. He was Jerri's oldest and closest friend she had known for 20 years, and his wife, Sue, happened to be Jerri's best girlfriend. Ever since Jerri discovered the lump, she had been thinking about writing to Dr. Nielsen about it. Up until that point, by mid-April, it was still the same size and shape as it was at the start of the month, but the only concerning difference was that by this point, it was beginning to hurt very badly. Not only this, but in addition to pain around the area, Jerri also hadn't been feeling well physically, and for those previous few weeks, she had been experiencing fatigue. These were not good signs, and she was genuinely getting worried. Jerri thought that there was at least one person at the poll who she trusted to know about this, and that was her best friend there, Big John. She went up to Big John and confided in him about what was going on and her concerns. As soon as she told him about this lump, he was very worried and he told her, "Look, Jerri, I think you should tell another doctor about this." And it was soon after that, on April 28th, when Jerri pulled up her email to send a message to Dr. Nielsen. In this email, Jerri gave updates on how she was doing, and she wrote to him, quote, "I also have a large hard breast mass, which worries me. I had a mammogram in October. The thing is hard and irregular and not going away." Dr. Nielsen was concerned to hear this, so he started laying down possible reasons for the breast mass. He cited fat necrosis, aka death of fat tissue, as being a possible reason. He mentioned fibrocystic breast, as Jerri had. He also mentioned how on a mammogram, these conditions would likely not appear, or if they did, it wouldn't have been a concern to those interpreting it. Dr. Nielsen additionally asked Jerri if she had a medication called tamoxifen. Tamoxifen is a type of hormone therapy drug used to treat breast cancer due to its ability to block the effects estrogen has on hormone receptor positive breast cancer cells. Jerri replied, letting him know she didn't have such medications and that even though she was feeling unwell and tired, The mass hadn't changed in over a month. So she asked him if she should just cut the mass out using a mirror. Dr. Lehman was glad to hear that the mass remained the same for a month. He even discussed this with a breast surgeon, and upon hearing this information, the breast surgeon said that's a relief, as she was convinced that this likely meant Jerri's breast mass had something to do with the fibrocystic breast. However, while Dr. Lehman was optimistic, Jerri wasn't so much. She knew that he only had information by what she's told him, but he obviously hadn't physically seen anything or done any tests. All she could do was accept the reassurance and put it to the back of her mind as to not hinder the job she had, working to treat people at the pole. To Jerri, this mass didn't seem like it was benign. It hadn't shrunk like she'd hoped, and not only was it still painful, but additionally, she began experiencing painful swelling in her lymph nodes under her right armpit. From everything she's known about breast cancer, through personal experience working with patients and through her medical training, everything she was observing and feeling was pointing towards this mass being breast cancer. She described, quote, "I suppose this was the greatest irony of my own life. Now that I finally felt fully and completely alive, I had to face the possibility that I was dying." Jerri initially thought it would be best to still not tell anyone about the breast lump other than Big John at the pole, because to her fate kind of seemed inevitable. She thought she'd either pass away while at the pole or pass away after leaving, and she didn't want to stress any of the polies out. But it was just a couple months later in June when Jerri noticed that the mass was now bigger, being just about the size of a grape. And it was after discovering this growth and also considering that the lymph nodes under her arms were somehow involved, when Jerri figured that if she did have cancer, that this could possibly end up affecting her ability to continue doing her duties as a physician. And because she knew that this could in turn affect the polies, it was in June, 3 months after discovering the lump, when she decided to tell her immediate boss, Mike Masterman, about what was going on. Jerri was hoping that Mike would be willing to excuse some of the polies from their regular work duties so that she could give them special medical training so they could survive in the scenario where she can't work anymore. At the hospital, she had some polies helping her out as a trauma team. That week, she actually held an airway course for the trauma team. Through this, she recognized that some people did have some skill in x-ray machines when working, suturing, foreign bodies, dealing with eyes, and just stuff like that. But there were just some more things she wanted them to have training in, so she decided to consult with Mike to request to let it happen. Jerri knocked on Mike's room door to find him on his computer, and when inside, she told him, "Michael, is it all right if we just have a quick chat?" Mike immediately stopped what he was doing, saved his work on the computer, brought his chair closer to Jerri, and told her, "Yeah, what's up? Let's talk." She explained to him, "Look, there's a reason I had the trauma team do some airway training this week, but I'm thinking this week they need some more training with the casting clinic as well." As mentioned, Jerri described how everyone at the pole were extremely close and they were able to read each other's emotions very well. So as soon as she began stating this, Mike was instantly concerned, and that was when Jerri told him the truth. In her book, she described the following, quote, "Mike, I have a large hard mass in my breast. It may be cancer. It's been there since March. I didn't tell you since there wasn't anything we could do about it. But now I have a lump under my arm and I'm starting to fear the worst. I may not survive to open the station, or I could become too sick to do my job." Jerri went on to tell Mike that she was hoping to train the trauma team so that they could select somebody to replace her in case the worst happened. But Mike was just like, "Okay, there has to be something we can do. Maybe we can cut the tumor out." He asked Jerri if she had contacted the ASA in Denver about this, but Jerri told him she hadn't done this because she wanted to go through channels at the pole first, as the polies had this saying that things that happen on the ice should stay on the ice. So she wanted to go through him first. Mike told her that he thinks she should get in contact with Dr. Gerald Katz, the physician advisor at the ASA, and Mike told her that he was going to do what he could do on his end to make sure they got to a solution for this. On Thursday, June 10th, 1999, Jerri sent an email to Dr. Gerald Katz. In this email with the subject line, "medical problem with me," Jerri described what was going on. She told him that the size of the lump was now 4 by 5 centimeters, and even told him that her mother's grandmother had actually passed away from breast cancer, but that nobody else in the family had it. And she ended off the email saying, quote, "What I am asking you is tough. You know the ice. Should I sit on this for 5 more months? Or should I perform an operation on myself and remove it?" Jerri also messaged Dr. Will Silva, the doctor she replaced, and also Dr. Hugh Cohen, the current McMurdo doctor who also served at the pole as well. And she asked for their advice. Dr. Silva wrote back hoping the lump might just be some inflammation, and he suggested that before doing a surgery on herself, that it might be best to do a course of a powerful antibiotic in addition to doing a course of prednisone, an anti-inflammatory steroid. Dr. Hugh Cohen also advised against surgery, reasoning that if this were breast cancer that also had involvement with lymph nodes, there wouldn't have been a way for her to remove this by herself with just one hand. And also, both doctors worried that if she did do this operation on herself, there would be concern of a serious post-operative infection. However, there was one procedure they both agreed would be safe and useful, and this was a fine needle aspiration. This is a minimally invasive procedure where a thin needle is used to extract cells, tissue, or fluid from a mass or lesion. With a fine needle aspiration, if the fluid from the procedure came back clear, this was a good sign and meant there was a good chance that the mass was benign. However, if it came back unclear, that's when there'd be more concern of a malignant issue. They all agreed to this fine needle aspiration, and shortly later, Dr. Katz began arranging a surgeon to help instruct Jerri on how she'd be able to aspirate the mass through a communication device of theirs. In addition to this, Dr. Katz also started giving a heads up to the officials of the ASA in Denver, also to officials of the National Science Foundation, or NSF, over in Arlington, Virginia, an urban county just about 6 miles from Washington, D.C. This is the governmental agency that oversees most operations of the US in Antarctica. Knowing how not private the pole was and how quick information spreads, Jerri didn't want this news to spread through a secondhand rumor. So that day she wrote to Dr. Katz on June 10th. She also gathered all the polies for a meeting to break the news. She put on a brave face and tried staying upbeat and positive for the polies, but deep down she was very scared. In true Poli fashion of always wanting and needing to fix things, they all started making suggestions on what to do. And a couple days later, on Saturday, June 12th, Jerri, along with one person from the trauma team, attempted to perform the aspiration by drawing fluid from the mass. She was assisted by her friend Paul Kindle, who she referred to as Pac-Man, or Pac for short, and described as the rock and roll electrician. Since summer at the pole, Pac had trained with the trauma team, and they thought he would be best to help with the procedure. Because Jerri wasn't legally allowed to prescribe herself with controlled substances, instead of using something like painkillers or tranquilizers, she instead used lidocaine and ice cubes as a local anesthetic. Pac then went on to perform the aspiration procedure since, as mentioned, this spot was hard for Jerri to reach herself. They were instructed to, quote, "sink a fairly large needle into my upper breast until it entered the lump, and then using suction from the hypodermic, try to extract its contents. A cyst would produce a clear liquid, a cancerous tumor would not." Now, Pac inserted the needle once, but they couldn't get anything. So he tried again. The needle was inserted a second time, but again, nothing. So then he went on for a third try and still nothing. And finally, the fourth try, he inserted the needle a fourth time, and unfortunately, again, there was nothing. Despite their efforts, every time Pac would insert the needle, he was not able to get out any fluid. Jerri described it was a solid, gristly, immovable mass. So after 4 unsuccessful attempts, they decided it was time to give up at that moment to try again later. Pac was not a medical professional. He was an electrician, so Jerri couldn't help but wonder, since she was the physician, if maybe she would have been able to find the fluid herself if she could. Jerri notified Dr. Katz about what had happened, and 2 days after the aspiration, on June 14th, he sent over an update to his superiors at the ASA and NSF, Eric Jurgen and Harry Mahar, asking for their opinions. In this email, Dr. Katz actually described the situation, saying, quote, "This is not a medical emergency." Nonetheless, he further emphasized the sense of urgency to figure something out. Jerri's breast was now swollen and in pain from the aspiration. Her armpit was aching, and the mass felt as if it were closer to the surface. With this pain now being near the armpits, she thought that this was an indication that if the mass was cancer, it had now metastasized or spread to the lymph nodes in her armpit. Otherwise, there was a possibility that swelling might have just caused irritation or infection from the procedure. Nonetheless, whatever the case was, this still very much felt like a medical emergency to her, and she was worried. Out of everyone at the poll, she only let Big John see this worried side of her, and he tried his best to keep her mind busy so she wouldn't stress as much. He would bring her books and movies, and he would speak with her about any interesting or not interesting topic, just anything to distract her. She would have good days, but also hard ones. On the Saturday following the failed aspiration, she spent time playing poker with the boys, but on the Sunday morning, she was, quote, crashing. She described how she was feeling depressed and wanted nothing to do but stay in bed all day that Sunday morning. But fortunately, Big John made sure to bring himself and call her closest friends, Lisa Beale, a computer specialist, as well as friends Lori and Andy and Joel, to the room to get her up from bed, help her comb her hair, and bring her to the gallery to go get lunch. They didn't want Jerri to lose the cheerfulness that she always had, and so they made it their duty to make sure she was never alone and just drowning in her thoughts. As the days and even the hours went by, the police were all worried for Jerri. They were so isolated from the world, and with how communication to the South Pole operated, it was hard for them to see the effort the ASA at Denver and the NSF in Arlington were making to figure out what to do behind the scenes. This was actually one of the gripes Jerri had with the South Pole Station. It was common for information to be withheld from the police about things that were directly affecting them. They were often left in the dark, which, quote, contributed to an atmosphere of suspicion. And with how Dr. Katz stated this was not a medical emergency, Jerri was concerned they might have just been putting this health issue on the shelf. So she emailed her friend, Dr. Lehman, the radiologist, pleading for assistance. Finally, on Monday, June 14th, Jerri received an email from somebody named Dr. Kathy Miller. In this email, Dr. Miller introduced herself as a medical oncologist who specializes in breast cancer at Indiana University. And she went on to tell Jerri how concerned she was after Jerri's friend, Dr. Lehman, reached out explaining her situation. Dr. Miller wanted to look into the possibility of sending medications that would stop estrogen production if an emergency airdrop was possible. She agreed that Jerri shouldn't cut out the mass or even start treatment like chemotherapy, for example, without diagnosing cancer first. And she wanted to look into the possibility of Jerri performing a biopsy and collecting images which could then be sent over to Indiana via video microscope. Big John soon began sending out emails to his congresspeople over in California and also senators, urging them to support an emergency airdrop of medical supplies and a flight surgeon to help Jerri. And he sent additional emails out to those on his mailing list, encouraging them to reach out to their representatives regarding this matter. Jerri just knew that if congresspeople and senators were to find out about a woman with a breast lump stranded at the South Pole, this could easily become a story that spreads in the media. So with how serious things were actually looking now, it was finally 3 months after first discovering the mass when Jerri decided that it was time to email her family and friends about it. She initially didn't tell them in an attempt to protect their peace because she knew how bad they'd be stressing to hear about the mass, and she especially didn't want this to happen if it ended up being something benign. But with how it's progressed, Jerri wanted to be able to break the news to them before they saw it in a newspaper somewhere. So the next day, on Tuesday, June 15th, she sent her loved ones an email updating them on what's been going on and the next steps it was looking like they were going to take. Jerri described that when sending this email, for the first time, she removed her children from the email list because even though she hadn't heard back from them while at the poll and believed there was a possibility that her emails might have been intercepted by her ex-husband, she still wanted to make sure they didn't receive the news via email so that they could instead hear it from someone personally. She requested that her mother call her children instead so that the news can be delivered in a more personal way. Unfortunately, though, she said that despite her mother's attempts to call, nobody answered the phone. And even when leaving a message and having Jerri's sister-in-law attempt to call, there was no response. Because of her concerns of the press finding out her identity, Jerri had actually been in contact via email with Dr. Rita Colwell, the director of the NSF, and Dr. Carl Erb, the director of the NSF's Office of Polar Programs, to request that they did everything possible to ensure privacy of her name or her picture, especially since, according to HIPAA, which was enacted a few years prior in 1996, her information should have been protected, and she was under the assumption that her wishes of privacy would be protected by the media. However, it was on Thursday, June 17, 1999, when the NSF did in fact issue a press release, and although they didn't name her in the report, they still mentioned her age and gender. This read, quote, "The 47-year-old woman, a U.S. citizen who is employed by Antarctic Support Associates of Englewood, Colorado, recently notified officials at NSF headquarters in Arlington, Virginia, that she had discovered a lump in one of her breasts." The trauma crew at the pole didn't have much time to prepare for the biopsy at all. It was going to be taking place the next week on Monday, June 22nd, which meant they only had just a few days to prepare to, quote, "set up a live video, hook up with doctors in Denver, draw tissue from the mass, transfer the tissue to slides, stain them to see the cells, and then transmit images of the slides to the States via a special video microscope." This is something that had quite literally never been done at the pole before, but something that was particularly concerning was the fact that they were supposed to have new, up-to-date stains. But if you remember, the last flight that was supposed to come at the end of summer to replace their supplies had been boomeranged back to McMurdo, so they were completely out of up-to-date stains. Just to explain, microscope slides are thin, flat pieces of glass that hold a specimen, such as tissue, to be viewed under a microscope, and stains are substances used to help visualize the specimen by enhancing it to make it clearer to see. To get slides stained, Jerri picked a man named Ken Loeb, as he had previous experience as a lab technician in Vietnam. But in addition to the stains, they also needed to have video transmission and satellite links in place so that the team in the States were able to monitor what was going on during the procedure. There was a man named Tom Carlson who was referred to as Comms Tom at the pole and also in Jerri's book. There's a few different Toms mentioned in this case, so going forward, I will refer to them by their nickname that they were referred to in the book to make it easier. Comms Tom was the person responsible for coordinating the biopsy session being connected with those in the States. This was an important role because they only had a short window where the satellite would peek over the horizon, so he had to make sure he got the timing all correct so it would line up for them to meet at the same time. Additionally, there was an astronomer named Charlie Kaminsky who Jerri referred to as Choo Choo Charlie and considered him a, quote, telescope wizard. He was responsible for fine-tuning the video camera attached to a microscope so that they could use this to magnify the images of the slides Lisa collected to transmit it over to the States. Jerri anticipated that the easiest part of this whole process would be the biopsy, as it was somewhat similar to the aspiration, just that the main difference between the two is that for the biopsy, she would need to use a larger needle, and this would be a more aggressive technique since instead of extracting fluid, this time, they would be extracting tissue. She was quite confident in the group she had to help her, especially as she had trained some of them in basic EMT training. And even without the training she did, some of them had previous experience adjacent to what they would be helping her with. For example, a man named Walt Fischel, Jerri nicknamed Welder Walt, previously worked as an army medic, and a man named Bill Johnson had experience suturing on horses. In the days leading up to the biopsy, a woman named Wendy sorted through the food supply and collected some unusable vegetables for Walt and Jerri to practice on. On Sunday, June 21st, the night before the biopsy, the crew had gathered and tested the syringes they had. Considering the syringes were frozen, they had to make sure at the very least they were functioning. After testing the 3 syringes they had, Big John actually had to throw away 2 of them because the suctioning wasn't working that well. but fortunately, the one that they didn't throw out was sectioning just fine. And finally, the day came, Monday, June 22nd, when Jerri was going to be doing the biopsy. In Denver, the ASA had gathered a man named Dr. Kareem Sergi. Dr. Sergi was a cell cytologist, and he was not only going to be responsible for directing the biopsy, but he was going to be responsible for interpreting the results from it. And after setting up the room, getting her hospital gown on, and getting on the table, Jerri was ready to go. The team had lifted the head of the operating table so Jerri would be able to see what she was doing a little better. And as she laid on that bed, equipment in hand, she started performing a biopsy on her breast. To start, she numbed the area up with ice, and as she was working away, she seemed so chill. Big John actually later described this moment in an email to Jerri's family, stating, quote, "You would have thought she was operating on someone else." Jerri extracted the tissue multiple times before handing the syringe over to Ken, who would prepare the slides before handing the slides over to Lisa, who would take a video of them for Dr. Sergi in Denver. And finally, after several tries, Jerri stopped, placed some ice on the area, drank a club soda, and handed the syringe over to Walt for him to have a go at it. They needed to continue getting tissue until Dr. Sergi told them that they had enough. So after Walt did some extractions himself, they placed ice on the area, and again, Jerri took her turn to finish off doing the extractions on herself. Finally, after a few more extractions, they were officially done with the biopsy. After a 30-minute rest with some ice in her room, the next door over, Jerri got up to try helping Lisa and another woman named Liza prepare the slides. But they told her, no, we got this, please go rest. For those next few hours, Big John stayed with her and they talked for a while about all different types of fun, interesting topics before Jerri felt like she could finally fall asleep at around 3 a.m. And the next day, Big John sent a message updating Jerri's family, ending off the email saying, quote, "She is the consummate professional. To see her in the gallery interacting with the crew, you would have never guessed what she is going through. She is truly a brave woman. We all love her very much." In the days following the biopsy, officials continued making preparations for medical supplies to be airdropped to the pole. This would be a military-level effort, and so the NSF reached out to the Air Force to ask if this would be possible. In the best-case scenario, they would just be able to get Jerri out of the pole, period. And this was something they actually considered doing. However, after actually analyzing the situation and even speaking with the Air National Guard, they determined that this would not be feasible. For planes at the pole, they would at minimum be able to handle a temperature of around maybe negative 58 degrees Fahrenheit or negative 50 degrees Celsius. If it got any lower than that, the cold weather would have the ability to disable the hydraulic system of the plane or even cause the fuel to freeze and crystallize. The pole at that point in time was sitting anywhere between negative 70 degrees Fahrenheit to negative 90 degrees, or negative 57 degrees Celsius to negative 68. So even if hypothetically they did land, there was a very good chance that the plane wouldn't be able to go back up again. It would be way too cold to even get it started up. Doing this would have been way too risky for everyone involved, and so they planned to have this airdrop take place sometime around the beginning of July. An airdrop was something that was truly feasible, and they actually had prior experiences doing airdrops during winter in Antarctica. Before the 1990s, in Antarctica, they actually did an annual airdrop during the winter as a kind of morale-boosting tradition to get the poleys through. This was when the U.S. Antarctic program was run by the Navy, but after 1993, when the Navy announced they were withdrawing from the program, and 1998, when they officially withdrew from the program, this annual airdrop stopped due to government budget cuts, just right before Jerri was at the pole herself. While extremely grateful they were planning to do an airdrop to help her, Jerri was also extremely concerned because whenever airdrops happened in the past during winter, they would typically be done in June when there was a full moon and when the skies were clear so that they could avoid bad weather. They were planning on doing this airdrop in July, which definitely didn't help because they soon discovered that the moon was going to be dropping below the horizon medication on July 6th, and it was going to stay below for almost 2 weeks until July 18th, meaning that during the time they had the drop planned, there was going to be absolutely no ambient light, and this would make it the first time in pole history where a midwinter drop occurred in complete darkness. It wouldn't have been until the end of July when they would get the next full moon to have some ambient light at the pole. But if Jerri had cancer, if they were to wait that long, it would likely be too late. She knew the risks involved even with just an airdrop. So even though she naturally assumed it was malignant to not get her hopes up, Jerri anxiously waited to find out her diagnosis because she didn't want all this effort to be put in for her if either the mass was benign or if even the cancer was just so advanced that her prognosis wasn't looking good anyway. Jerri described herself as being somebody who heavily relied on statistics and knowing numbers. So for her own sake, to feel better about the situation, she wanted to know if this were cancer, were her chances of survival high or were they low? She sent emails to Dr. Kathy Miller just asking if she would be able to give her some numbers of what her chances were looking like. But unfortunately, not only did Dr. Miller not have exact numbers, but just getting a diagnosis for her was proving to be very difficult. Lisa was having a hard time getting the cell images on the slides enhanced so that they would be clear enough for pathology teams in both Denver and Arlington, Virginia, to properly interpret them. They were already working with very limited, not high-tech equipment, and it especially didn't help that the stains were outdated. So getting a clear image sent over would be an honest mission in itself. And with Dr. Miller also not knowing much about the situation and truly only just having Jerri's word to rely on, she unfortunately couldn't get Jerri the answers she was looking for regarding her chances of survival. She did think it was looking like Jerri's survival chances were looking good, and Jerri was appreciative that Dr. Miller believed she had a good chance, but she still had a hard time believing that that was actually true. To Jerri, if she had cancer, there were only two options for her. It was either a death sentence or it was not a death sentence. There were no ifs, ands, or buts. There was no in-betweens. She even described, quote, "I believed that my fate was predetermined." It had already been 3 months with no treatment since Jerri had first noticed the mass, something which Dr. Miller mentioned would adversely impact Jerri's survival due to how long she had gone without treatment. Dr. Miller acknowledged and validated Jerri's feelings, but she told her that at the end of the day, at the very least, with an airdrop of medications to treat her, Jerri would be given a chance of survival, but without an airdrop, it was guaranteed there would be no survival for Jerri whatsoever. To get this airdrop done, they were going to be sending a C-141 Starlifter cargo plane from the Air Force Base, piloted by Major Greg Pike. This plane was a larger version of the LC-130 Hercules that Jerri had arrived at the pole in. In this aircraft, there were going to be 22 members of the military who volunteered to fly to help with the drop. This group was going to be more than the usual amount they would typically use, consisting of people like the pilot, mission commanders, loadmasters, navigators, and engineers. The Starlifter was able to take no more than 6 500-pound packages maximum, and as they loaded, they ensured the priorities, which were the medical supplies, were in there. And if there was extra room, they included vegetables and fruits, which police referred to as freshies, as well as mail for the crew. Mike Masterman assigned jobs to police for the drop. The plan for the drop was that the plane was going to fly over the pole, dropping only 2 packages at first to make sure everything worked. And then after that, they would circle back around to then drop the remaining 4 packages. Mike instructed the group that until the 6th and final package was down, nobody should go into the drop zone, and he further went on to warn them about how eager the media was to get the story covered. Even with the request to prevent the press from releasing Jerri's information continued to get released to the public. On July 6th, Carl Erb from the NSF issued a press release about the airdrop, again identifying Jerri as a 47-year-old woman, and journalist Dan Rather also issued a lead report on the story identifying Jerri as a 47-year-old mystery woman. After the report was issued on July 8th, Jerri's mom emailed her to give her an update that information about her was released, and it didn't take long after the release when everyone began talking about this airdrop that was going to occur and who this mystery woman was. Jerri's brother Eric was getting calls from his boss talking about it. Friends and relatives sent copies of articles talking about this. And it wasn't just a topic in the States, but it was international as well. It went from being featured in the Washington Post to being featured in the Sydney Herald. Everyone wanted to figure out who the person they were talking about in these articles was. And Jerri grew continually nervous that it wouldn't just be her age that was revealed, but her name would be revealed too. Several reporters had been reaching out to everyone they could possibly find who had some type of connection to the poll, just to ask them about who this mystery woman was. They wanted to cover this mission in real time. There was an airing planned on CBS, and a recent newspaper article was even written about the whole situation, titled "From Hell on Earth." So Mike told everyone if any of their family members were being harassed, let him know so they can get it handled through their email dedicated to handling press. Mike then went on to end off the meeting by reminding everyone to be on alert for the all call in the evening so that when the time came, they'd all report to their proper stations once the airdrop was ready. At 8:30 p.m., Comms Tom, who was in contact with the Starlifter flight crew via radio, got on the all call and he announced, "Great news, everyone. The plane had refueled in McMurdo and it's now officially on its way to the pole." And just the next hour at 9:30 p.m., Mike called the smudge pot crew to begin lighting the fires for the drop zone. According to Jerri, the smudge pots were 55-gallon oil drums cut in half and filled with wood, jet fuel, and gasoline. There were 27 smudge pots, and they were all spaced out every 34 meters, arranged in a C shape. So in total, the smudge pots were spread about 914 meters, almost a kilometer, along the skiway, lighting the area up. Not only this, but the flight crew also requested that the lights inside of the station were blacked out so that the drop site looked more clear. It was also extremely cold, with the weather hanging around negative 92 degrees Fahrenheit to about negative 69 degrees Fahrenheit, or negative 69 Celsius to negative 56. And because of this, they actually had to jump up and down to keep warm. But not too long went by when suddenly the crew began hearing this very loud noise. And as they looked up, they saw clear as day, or in this case night, an aircraft with red and green running lights and a white tail light coming towards them. As the plane got closer, they could see the cargo door was visibly open, and this allowed them to see one of the loadmasters backlit from the cabin light. A loadmaster, by the way, is the aircrew member responsible for moving the items. With how cold it was, they were going to be dropping the packages out of a door instead of the back of the aircraft as they normally would, and they only had about 15 seconds to get this drop done. And so they gathered 2 packages which had strobe lights and chemical flares attached to them, and they threw them, one after the other, out of the plane. Which, by the way, it was so cold, the flares actually got extinguished before they even touched the ground. After these 2 packages were dropped, the plane left the scene, and after those at the pole reported to the aircrew that they successfully landed, 10 minutes later, the same thing happened again. The plane came back around, and the crew dropped out 4 more packages before flying away from the pole. And as soon as they heard the all clear, the snowmobile drivers, with the radio guidance from the spotters, quickly headed out toward the skiway to find the packages. In some of the packages, there were perishable items that weren't allowed to be frozen, so they had to quickly recover those to get them in the proper temperature they were supposed to be at. Once they got to the package, they needed to load them onto a bulldozer to then carry back to the garage of the dome. It didn't take them too long to find the first 5 items. However, the 6th one was proving to be a difficult find. They searched and searched, and finally, it would be a whole hour and a half later when Charlie announced that he found the 6th package sitting about 200 yards outside of the drop zone after there was some parachute malfunction causing it to not land in the proper area. When they arrived to help retrieve it, they saw that the box had been crushed on one end and some of the contents from the box had scattered everywhere on the ice. This included x-ray film, freshies, vegetables, coffee filters, tobacco, and even cigars. And so they had to collect it all in buckets to be able to bring it over to the garbage. This was a very important package to find because all essential medical equipment they were sent as duplicates. Number 6 contained the ultrasound machine. However, they didn't consider the ultrasound machine as being essential, so it was not duplicated, despite being, quote, the most expensive and delicate item. After celebrating this successful airdrop with music and dancing, they did eventually unpack the packages, including package 6. And unfortunately, they found out that the ultrasound machine had been crushed so badly during the drop that it actually was damaged beyond repair. Nonetheless, everyone's spirits were still high, especially considering all the other packages did in fact survive the drop. And this included important equipment like microscopes, medicines, stains, freshies, a new movie, and everyone's mail. Not only this, but the materials people over in Washington and Christchurch even included special gifts for Jerri, including a bunch of colorful silk flowers, military medallions, and stacks of cards and letters. The airdrop team also wrote Jerri a bunch of kind messages on one of the cardboard packing boxes, and Jerri even saved half of this box for herself and the other half to be placed in the Christchurch Museum.
All right, Doc, what do you think about tonight?
It was fun.
Was it exciting?
Yes.
Was it an adventure?
Yes.
Is this the total polar experience?
Yes.
All right. All right, good for you.
On that night, Dr. Miller sent Jerri an email with instructions on how to proceed with the medications, and also she sent her some more information on when and how to administer them and their side effects. Most notably, she discussed the medications Lupron and tamoxifen. Lupron is another hormone therapy drug used in the treatment of cancers such as breast cancer or prostate cancer, but it is also used for the treatment of other conditions such as endometriosis, for example. Dr. Miller told Jerri, quote, Lupron stops your ovaries from working. And for Jerri specifically, the Lupron was to be injected intramuscularly once every 3 months. And 20 milligrams of tamoxifen was to be taken orally every day. The side effects Dr. Miller warned Jerri of were ones relating to a lack of estrogen, including no more menstrual periods, hot flashes, mood swings, and a small increase in the risk of blood clots. She also further instructed Jerri to measure the mass area before starting the medications to get a baseline, and then to measure it again after about 6 weeks. The goal would be for the area to either stay the same size or get smaller. However, if it were to get any bigger, then they would need to proceed with chemotherapy. The excitement from the successful airdrop started to wear off, and this allowed Jerri to focus on the current medical situation. Jerri went on to teach Charlie how to administer the Lupron shots, and a couple days after the drop on July 12th, she wrote a letter to everyone at ASA showing gratitude and thanking them all for everything they did to get the drop to happen. But as she just began truly locking in and focusing on the current medical situation, she unfortunately also had to focus on what was happening with the media, because reporters were still pushing to reveal who this mystery woman with this lump in her breast was. In fact, after connecting the dots, some news sites had actually figured out and known for weeks that it was Jerri who was the mystery woman. This included news companies like the Associated Press, CBS News, and New York Times. The good thing with the Associated Press is that they hadn't run the story about Jerri yet, simply because they had nobody who could officially confirm Jerri's identity. However, unlike the Associated Press, Jerri was informed that the other news companies were actually most definitely planning on disclosing who she was, because it was just that next day on Tuesday, July 13th, 1999, when the New York Times was the first to break the news in an article titled, "Trapped at the South Pole, Doctor Becomes a Patient." Jerri was horrified to see this reveal, and she was even more shocked when she actually read the article, because after reading it, she discovered that a, quote, cancer expert who was consulted in her case was the one who revealed this information about her identity. She said this made her feel absolutely violated, humiliated, and it made her worried that she couldn't even trust her own doctors anymore with her personal medical information. So she sent a message to Dr. Gerald Katz, who she initially contacted about her situation, and told him how important it was for her identity to be kept private and how now she doesn't feel comfortable sending any messages about her health situation. But Dr. Katz replied to Jerri, assuring her that it wasn't any of the primary physicians who revealed her identity, but that it might have been someone from the tumor boards or curbside consultants who might have done it. Nonetheless, this still didn't change how Jerri felt, and it wasn't too long before news sources started to use her actual name in articles. Not just this, but reporters from all different companies were calling Jerri's parents, brothers, and childhood friends requesting more information to make a report about her. And not only were her loved ones hounded with phone calls, but a reporter from the Daily Mail had even showed up to Jerri's parents' home in Ohio to get information from them. When this reporter got there, they seemed very trustworthy, so her parents let them in, gave them cocktails, and even got them something to eat. At the time, they didn't have any reason to believe reporters or photographers would be shady or have ulterior motives, especially considering the type of story this was. But unfortunately, they would come to find out that these reporters actually didn't have Jerri's best interest at heart. Jerri even described that her parents were conned. When the article following this was published, her parents were mortified because the reporters included false information regarding Jerri's family, regarding her job, and Jerri described it even, quote, ended with a quote from my daughter indicating that she didn't care what happened to me. A New York Post article from October 1999 recounted this article, saying, quote, her daughter told the Daily Mail in London last July that she, quote, couldn't care less what happens to her mother, adding, quote, I haven't spoken to my mother since November when we had a fight. I now want nothing to do with her any longer. Jerri was hoping that this might have just been misquoted, but either or, she was very hurt and realized that she might have truly lost her children forever. Still, on July 20th, she sent an email to her mother expressing her feelings about everything that just happened and told her parents not to feel guilty about what happened with the article being posted. After the airdrop, Jerri described how the hounding of her loved ones by the press kind of chilled out for a bit because media attention shifted from Jerri's case to the passing of John F. Kennedy Jr. from a plane crash on July 16, 1999. But while this only briefly made the media stop bothering Jerri's loved ones, the media still didn't forget about them. Reporters had actually sent the NSF boxes requesting to interview Jerri. Photographers and TV crews were still outside lurking at Jerri's parents' house, and this still unfortunately wasn't all the drama she was dealing with because an Ohio newspaper even managed to find Jerri's ex-husband, who she described was allegedly, quote, giving interviews to Scandal Sheets newspapers, openly disparaging me and telling anyone who would listen that I was inventing my disease to get attention. She described how her ex-husband went on to not only call, but to email both of her employers, the ASA and NSF. In one letter to the NSF, Jerri stated that her ex-husband had allegedly requested that communication regarding Jerri go directly through him since he was the ex-husband. And Jerri stated that in another letter to the NSF, he essentially called her out as a fraud in nature, and he allegedly encouraged them to look over her resume, describing that the way she actually was different from the way she appeared. Jerri described this saying, quote, he was trying to convince those who were deciding whether or not to save me that I was deceiving them. I hate to think what might have happened if they had taken him seriously. An article from The Guardian on August 30th, 1999 stated the following, quote, Mr. Nielsen, who has remarried since divorcing Dr. Nielsen a year ago, is somewhat less overawed by his ex-wife's bravery. He points out that neither he nor his children has received so much as a one-line email from her since his ex-wife arrived at the South Pole. Quote, who puts themselves thousands of miles away, inaccessible to children who might need her. None of the reporters except for them had directly quoted her ex-husband regarding the faking cancer bit, as Jerri claimed they apparently didn't find him to be necessarily the most credible source regarding that. However, what Jerri said the reporters did instead was they allegedly used his words against the family and friends to sort of coerce information out of them by telling them that they would need to set the record straight. Otherwise, the information they published would just be his word. Thing is, while most of her family and friends did want to clear the air and protect Jerri's name, Jerri actually told them not to do this because she didn't want this to turn into a, quote, he said, she said marital fight, as this would continue to cause more damage to the children. Jerri's family was absolutely terrified because they were essentially being stalked and were very badly harassed by reporters who were hiding in the trees or taking pictures as soon as they got home. People were sending them flowers. They even received letters from celebrity journalists. They quite literally had to stay locked inside their home with their lights out to avoid further harassment. And even inside their home, they kept getting continuous phone calls to the point they just had to get up and get a new private phone number so their phones wouldn't be ringing so constantly throughout the day. This harassment of her family just added on so much extra stress Jerri and her loved ones did not need. And so Jerri went on to ask the public relations teams from the ASA and NSF if they would be able to handle all of the press-related issues they had so that pressure could be taken off of her family. The hounding of the media on her family and friends was actually weighing on Jerri more than the fact that she likely had cancer, and she described that these were the most miserable weeks of her life, simply because of the harassment her loved ones were receiving. During this time, as the pathologist in the States made efforts to interpret the slides from Jerri's biopsy, Lisa at the poll was trying to restain them with the slides from the fresh dye the Airdrop provided, and also used a new video microscope system from equipment received from the Airdrop to get the images retransmitted over to the States. But unfortunately, despite having all of this new equipment, this still wasn't enough for the doctors to clearly interpret the images. So just a week after the Airdrop, with the help of Walt, Jerri performed a second biopsy on her breast, and Ken Loeb got together a new set of slides for transmission to the States. Walt described this as being easier this time because instead of it being the size of a grape, the mass was now the size of a golf ball. After a few days went by, Jerri received the results from the biopsy, but this was done in the most bizarre way. On the morning of Thursday, July 22nd, Jerri and Lisa were looking through Lisa's email to search for news regarding the slide images when they noticed a message from a pathologist at the National Cancer Institute in Bethesda, Maryland, just about 7 miles from Washington, D.C. Once they saw this email pop up, Lisa clicked it, and they both eagerly began reading. The message started off with the typical information, just a few sentences discussing how the staining and how those slides work, and then they started getting down towards the bottom of the email when suddenly Jerri described, quote, "For a moment, I couldn't breathe. I felt like someone had kicked me in the stomach and ice water was flushing through my veins." Because this email read, quote, "These slides show carcinoma of the breast." Carcinoma meaning cancer that forms in epithelial tissue. Jerri described the moment after reading this, stating, quote, "I held onto Lisa's shoulders as a phrase kept running through my head. This is the way the world ends. This is the way the world ends. All of my mental exercises had not prepared me for this awful news, not when it was delivered like this, tossed casually into a correspondence between strangers. I felt like an eavesdropper at my own execution. This is the way the world ends, not with a band, but a whimper." She found out about her breast cancer diagnosis indirectly through an email. And this upset a lot of people, including Dr. Miller, who was appalled as she stated she had planned to tell Jerri the evening of July 23rd during a video call. Still, Jerri went on to tell her loved ones and the police. Jerri had doubts that chemotherapy would save her life, as she wasn't too hopeful on her chances for her survival. But still, she willingly agreed to get started on it immediately because she knew at the very least it would give her a shot as opposed to doing nothing. The plan was for Jerri to start doing weekly infusions of Taxol. Taxol is the brand name of a chemotherapy medication called paclitaxel. This was a relatively new drug at the time. It was approved for the treatment of breast cancer 5 years prior in 1994 after showing evidence of shrinking larger and fast-growing tumors such as the one Jerri had. Lisa and Com's Tom were able to set up a video conferencing system for Jerri to video call with Dr. Miller in Indianapolis so that she would be able to monitor her treatment and be there for guidance in case something were to go wrong. For IV medications, there's typically a recommended rate for the drip to occur at. For the Taxol, Dr. Miller had prescribed Jerri to have the drip administered for 1 hour. At the Pole Hospital, however, they didn't have the usual equipment that was available at big hospitals, which administered drugs at a prescribed rate. So, because of this, Big John did some practicing to help Jerri with administering the chemo at the prescribed rate. He also helped with measuring the mass, leading them to discover it had now grown to 5.5 by 4 centimeters, which for reference is roughly the same size of a hen's egg. Jerri even described its size by referencing boxing, saying, quote, "In the arena of breast tumors, this was a heavy weight." Dr. Miller and oncology nurse Latrice Haney, who, fun fact, was actually Lance Armstrong's head oncology nurse at the Indiana University Hospital in 1996, were able to assess the type of IV lines they were using at the pole to calculate the rate of drips they needed to administer per minute. Friday, July 24th was when they did the first session of chemo. Dr. Miller and Latrice appeared on the video camera, and while they were easy to recognize, according to Jerri, it was still disorienting, as it wasn't the best quality, even on Dr. Miller and Latrice's end. Before administering the chemo, Jerri took a dose of oral Kytril, which was meant to help prevent nausea, Decadron, which is also known as dexamethasone, a steroid which has many purposes, including easing side effects like nausea or decreasing inflammation, and she took Benadryl, an antihistamine, to help minimize any allergic reactions to the Taxol. These medications Jerri took made her feel a bit woozy, and so she actually ended up keeping one eye closed as it was hard for them to focus open together. Over at Indianapolis, Dr. Miller and Latrice instructed Club Med that the first 10 minutes of the chemo should be administered slowly, and after doing this for 10 minutes and having Jerri show no reactions, Big John was given the okay to increase the flow. Jerri had used her own bed in the hospital to feel more comfortable during this session, but the IV was kind of in a tricky position, so she described she felt a little bit of dysphoria or uneasiness during the session, which Dr. Miller later on explained could have also been the result of the medications dexamethasone and Benadryl. At first, the session seemed to be going just fine, but once they reached 30 minutes, which should have been halfway, the bag with the chemo was nowhere near halfway done, and to add to this, shortly after, the crew suddenly lost connection to Dr. Miller and Latrice. Fortunately, they were eventually able to get the visuals back on through separate channels, but they weren't able to get the audio. So, for the rest of the call, they just ended up writing notes on paper to hold up to the camera whenever they had something to say. But still, concerningly, they reached the hour mark and they were nowhere near done. In fact, it took a total of 3.5 hours for the infusion to be complete. And this was very concerning because for the Taxol to go on longer than its prescribed rate, this posed a greater risk for Jerri to have harsher side effects. Nonetheless, the next day, when Dr. Miller followed up with Jerri about the chemo session, she expressed how impressed she was and said how she and Latrice had so much respect and admiration for the work they did to not only get the job done, but to successfully set up the communication systems. After they were finished up and Jerri got some rest, Big John actually stayed awake beside Jerri, listening to her sleep to make sure she didn't stop breathing or nothing drastic happened. That next morning, Jerri woke up with little sleep and the day started off just fine. She went on to decorate and make treats for a toga party that she initiated called Christmas in July to celebrate the birthdays of 2 Polies, and she felt relatively fine for the most part. However, in the evening, She was nauseous and threw up twice, and she wasn't sure if this nausea was from chemo or if it could have been something she ate. Not just this, but throughout those next few days after the chemo, Jerri began experiencing even more side effects. On that Sunday of the 25th, she had an episode of abdominal cramps, her breast was hurting, and overall she felt fatigued. Eventually, she even began suffering from hot flashes, which in a place like the pole isn't helpful as her hair would sweat from being hot just for it to freeze in the cold weather. Not only was Jerri dealing with the physical side effects, but she was also faced with mental struggles as well, as she was worried about many aspects of her life. Dr. Miller checked in on Jerri to guide her through treatment, such as doing blood tests, and she also provided reassurance to Jerri, who was losing hope. Jerri told Dr. Miller, quote, "I must confess that I have lost all hope. I even see treatment as a useless and stupid way to end a life. I have often felt that for my patients. Why bother after a point? I can't even think. But I am not depressed. I just can't see why I should try." But Dr. Miller told her that their goal was to get her well, replying, quote, "If I thought your disease wasn't curable, I'd say so." Dr. Miller was also very transparent about survival and the likelihood of recurrence, as those real stats were things Jerri really wanted to know to kind of help her look forward. The plan was to have her do chemotherapy for 3 months, ending just around the time she would be out of the pole, followed by surgery and probably followed by more chemo and radiation, which were things that wouldn't have been possible to do safely at the pole, nor did they even have the tools to do. At around 9:30 p.m. on Friday, July 30th, 1 week after the first round of chemo, Jerri had her second round of chemo, and it went by much more smoothly. The Club Med crew were able to work really well together after that first round, and they all kind of trained each other as everyone got better. And Dr. Miller and Latrice were very impressed on how quick they were able to get things down pat. Dr. Miller even jokingly offered to hire Big John based on how good of a job he did with regulating the drip compared to the expensive $1,000 pumps that did it at their hospitals. And over time, as progress was made, more results came, and stats were available, Jerri began feeling hopeful again. On Monday the 2nd, Jerri sent messages to her family expressing how much more hopeful and happy she was now. She told her brother Scott that she decided she does want to try giving this a chance, especially so that they can go on a sailboat trip they planned together. And after stating that she was finally coming to terms with a cancer diagnosis, she told him that she was finally ready to deal with the press, stating, quote, "As soon as the satellite comes up, I am going to talk to the NSF PR person about going public with the media. I am tired of being hunted, so I must come out of the closet." And so, on Monday, August 2nd, Jerri wrote to Julia Moore, the person in charge of the NSF's public relations, and told her that she changed her mind regarding avoiding the press. In even better news, Jerri measured the tumor again, and she discovered that it went from initially being 5 centimeters across and 4 centimeters down to being 3.5 centimeters across, 3 centimeters down, and 1.5 centimeters deep. Although she stated it was hard to measure as the borders were indistinct and they weren't able to get a baseline depth as they couldn't find the bottom, it seemed as though the tumor was in fact shrinking. She sent a message to Dr. Miller that Thursday, August 5th, telling her this, and Dr. Miller admitted an omission, telling Jerri that the typical time it takes to see if a treatment regimen is working well is about 2 cycles of therapy. So the fact that there was a difference with only 2 weeks of therapy was a great sign. Dr. Miller also informed Jerri that it is normal to see a slowing down of the change in measurements as the next several weeks go by, but she assured her that it's completely normal and it doesn't mean that the chemo isn't working as well. Additionally, there was some more surprising news Jerri had found out regarding the progression of her treatment. At the end of July, on July 28th, Jerri wrote a letter to Carl Erb, the director of the U.S. Antarctic program, updating him and thanking him for the efforts made to help her. Carl replied very quickly in a friendly email, and he told Jerri that he had actually made a request with the Air National Guard, asking them to look into studying the possibility of sending a special flight to take Jerri out of the pole sometime in September or October in case the tumor didn't respond adequately to the treatment. Jerri had mixed emotions about this. While she was grateful for their efforts and concern, she didn't want to risk any other lives just to help her, especially in the scenario where this rescue or an early extraction wasn't necessary. So she replied back with her thoughts, letting him know that this decision would be dependent on how she responds to chemo and also dependent on Dr. Miller's thoughts on it. On that same day, she messaged Dr. Miller to inform her of the NSF's possible plans and asked if this would be necessary depending on how she responds to the treatment. Dr. Miller replied back that she was actually asked this directly by Drs. Carl Erb and Gerald Katz, but stated her reply might not have been too helpful to them, so she gave the following 3 options on what she could tell them. If the tumor shrinks, she'd continue with Taxol until it's safe to get Jerri out of the pole with the rest of the winter over crew. If the tumor doesn't respond, they try a new regimen. And if the tumor doesn't respond to that one, then Dr. Miller wants Jerri out of the pole as soon as possible. After starting chemo, Jerri still tried to settle back to her normal life at the pole by seeing patients and organizing or cleaning the hospital. Even though she was a patient herself, she felt guilty whenever she dedicated time to tend to her own illness and not someone else's. But interestingly, she actually began looking forward to the weekly chemo sessions and meeting with Club Med. The treatment schedule for her was to have a chemo session once a week for 3 weeks in a row and then have 1 week off. And even though the IVs were painful and would make her feel unwell after a few days, Jerri felt good knowing that she was doing just what needed to be done to help get rid of this tumor, and it was nice for her to watch how quickly the tumor responded to Taxol, shrinking so much in just those first couple of weeks. She still did have worries that the cancer had metastasized, especially because of the bad pain she had, not just in her breast, but under her right arm and beneath her shoulder blade. But Dr. Miller assured her that her axillary or armpit lymph nodes being painful or having disease doesn't mean she will pass away, and that the pain could truly just be from inflammation, which is common with large tumors, especially since the dead stuff from the tumor gets drained out and has to go somewhere. She again assured Jerri that the proper tests to determine if there's metastatic spread will be done when she gets back to the States, but she stated that nonetheless, there's still nothing she's heard from Jerri which indicated that the cancer had metastasized. Dr. Miller also gave Jerri some more warnings on what to expect with fatigue being off and on, depending on when she did chemo. She said it would likely get better during off weeks, and that the fatigue should slowly get worse with each treatment, with the 3rd week being the worst. However, she said the easiest should be the off week and the 1st week of each cycle. This fatigue did end up coming just like Dr. Miller had predicted. Jerri described she felt like she was walking through jello. She was even too tired to stay awake for the events they usually did, such as watching 2 movies every Saturday night. And while she still saw patients, she described she was a bit behind on paperwork and other projects, which certainly didn't help in combination with the conditions at the pole, which contributed to things like sensory deprivation or chronic hypoxia. Not only this, but Jerri also had worries about losing her hair because she noticed that every time she would brush it, the bristles would become clogged by her hair, and eventually big clumps would come out even if she touched her head. Losing her hair was something she described as unbelievably depressing. She believed that her hair was her best physical feature. It took her 6 years to grow it into healthy, long, and thick hair, and because of this, she stated her hair played a big role in her self-esteem. She described, quote, "Losing my hair was like losing a vital piece of my identity." Further describing, quote, "I looked in the mirror and saw a stranger, a sick, ugly thing that bore no relation to who I was. I did not want the world to think of me as a partial person. Inside, I was still very strong and professional, and if I had to step in front of the cameras, that was how I wanted to appear." Jerri expressed her concerns with Dr. Miller, and Dr. Miller too agreed that the media was something that Jerri should get over with as soon as possible. They began pushing for the NSF to get their media strategy together, but what had happened was the officials of the organization actually ended up changing their mind regarding dealing with the media because despite the hounding Jerri's parents still faced, they believed that the media attention died down, and even though a rescue hadn't been in the works yet, they believed that talking to to the press might end up causing too much commotion or frenzy in the scenario where they would need to do an early rescue flight. What made no sense about this, though, was that in the same breath, Jerri found out that the NSF had actually been fielding requests from TV networks so that if they did do this early extraction, they would allow a news crew to board the plane and film the rescue. Then, after they landed in the States, they had plans for the reporters to follow Jerri to the hospital to then get a recorded reaction of when she heard her test results, and they also had plans to record and document her treatment. Almost like a reality TV show of her finding out very personal news. So Jerri replied to them, telling them that by that point, she'd be way too sick to even be bothered with the media, and that it would be a terrible invasion of privacy if a TV crew were to follow her while dealing with her health situation. This plan of recording her, fortunately, did not end up happening. However, the fact that they even thought about doing this is wild. In other good news, of which Jerri described was done, quote, perhaps to soothe her feelings, the NSF and ASA allowed both of Jerri's brothers, Scott and Eric, to be part of the early extraction team, which the police called the Bro Squad. She couldn't wait to see them and felt protected knowing it wouldn't be just her alone with the photographers, and Big John just expressed to them that this gave Jerri the best mental boost she needed. The plan was for her brothers to meet Jerri at Christchurch to then fly from there to the States. And since Jerri now knew that she wouldn't be dealing with the media, she decided it was finally time to shave her head with an electric razor, which Lori and Lisa called a Make Jerri Totally Bald party.
Welcome to the South Pole edition of Start the Madness.
It only took them a few minutes to shave Jerri's head, and while Jerri did mourn the loss of her hair, she still put on a brave face and tried to move on. After they shaved her head and walked out of the room, Jerri was greeted by the fellow women police, and just as she was about to say something, they all reached out into their shirts and pulled out self-knitted hats. The women at the pole threw Jerri a surprise hat shower or hat party. This generosity meant the world to her and made this moment much more helpful for her. The women as a collective at the pole, ranging from ages 22 to 47, Jerri being the oldest, and having very different personalities, weren't necessarily a close girl group, but they still came together with compassion and support. After this party, Big John also took Jerri for a snowmobile ride to try to cheer her up, and Jerri was extremely appreciative of all of them. Big John, by this point, was in frequent contact with Jerri's family. She tended to brush things off to not concern them too much, so they reached out to him when they wanted the truth on how Jerri was really doing. All messages he sent to the family, he sent copies of them to Jerri so she knew everything he would tell them. And in addition to updating them, Big John was also always there for Jerri, doing things like missing parties to stay up and make sure she was breathing while asleep, for example. Even though he expressed to her that he was poor, so he couldn't get anything for her, she expressed how his time is all she needs and she couldn't imagine life without him. Unfortunately, for the next few weeks, while Jerri was still working, her condition progressively got worse. For those at the pole during winter, they had a tradition where they would head to the geographical pole to take a picture. And for the first time in the 10 months since landing at Antarctica, Jerri experienced her first case of frostbite, which she actually described as being something she earned, stating, quote, "Frostbite is a rite of passage at the South Pole." Jerri was feeling fatigued as they made their way to the geographical pole, which was unlike her usual fit self, and even as she got closer to the pole, she was feeling nauseous, which made her nervous because she was standing on thousands of years old clean ice and snow, and she didn't want to vomit and contaminate it. With it being negative 95 degrees Fahrenheit or negative 70 degrees Celsius outside and feeling like negative 50 degrees Fahrenheit or negative 101 degrees Celsius with the wind chill, as they headed on their way back, that's when she ended up getting frostbite on her face. 5 had gotten frostbite in total. Still, the group was able to successfully get the picture, adding the Fun 41 to the walls of the public areas at the pole alongside the images from previous years. Even though Jerri was responding well to chemo, Her veins weren't. They were collapsing from the constant sticking. For a couple weeks in a row, the Taxol had even infiltrated her arm, which hurt very badly and caused them to restart the IV multiple times. With this, at the beginning of September, Dr. Miller wrote to Drs. Gerald Katz at the ASA and Carl Erb at the NSF, updating them about how Jerri was doing. She stated, quote, "I am becoming increasingly concerned about our ability to manage Dr. Nielsen's treatment at the pole. A late October evacuation would require us to be able to administer another 7 weeks of therapy. I honestly don't see how that is possible. I think it is time to readdress the question of early evacuation." Dr. Miller was now pulling the plug on Jerri continuing this pole trip, and she was telling them that Jerri needed to be taken out early. By that point, Jerri was actually relieved that Dr. Miller was calling the shots for the early evacuation because she had constantly been feeling tired and sick and even had groin pain, which started to concern her. Not just this, but around this time, Jerri noticed that the mass seemed to have actually gotten larger. I'm not sure what the last measurement was after the last one cited when Jerri was noticing it getting smaller. However, as of September 14th, 1999, the latest measurements of the tumor was 3 centimeters wide, 2.5 centimeters across, 1 centimeters deep, with the margins still indistinct. Thing is, the measuring equipment they had wasn't one that was accurate, so Dr. Miller wasn't too worried by this, especially as it wasn't a significant change, and they agreed that Jerri should just measure again before the next round of chemo. For several weeks by that point, Jerri had been receiving oxygen every day after lunch and sleeping with it every night. Even though she initially did not want it, as she knew there were limited resources at the pole and didn't want special treatment, Dr. Miller believed it would help with nausea, mental fuzziness, and with healing her veins. And it did in fact help her feel better. After Jerri's chemo session on Friday, September 24th, she measured the tumor to be just slightly larger, measuring 3 centimeters wide, 2.7 centimeters tall, and 1 centimeters deep. While this could have just been a slight variation, Dr. Miller still reiterated that tumors should not grow on Taxol, and she brought up the possibility to Jerri of needing to start a new treatment regimen in the scenario where the cells had become resistant to Taxol, allowing the tumor to grow. Dr. Miller told Jerri to do another measurement on Thursday the 30th and told her that if from that measurement they see that it's truly growing, they would then switch Jerri from Taxol to what they called the CMF cocktail, which is the combination of the 3 chemotherapy drugs called cytotoxin, methotrexate, and fluorouracil, or 5-FU. These medications were described as being similar to Taxol, with it likely causing the same amount of fatigue, but with less nausea, less harshness on hair, and more likelihood to cause bone marrow suppression. After doing the measurements that evening, it was at 9:18 p.m. when she sent an email to Dr. Miller titled "New Measurements." And in this email, she said, quote, "Dear Kathy, the thing is a monster, 4 centimeters tall, 4 centimeters wide, 1.5 centimeters deep." Jerri was very afraid by this because not only was it getting larger, but it was extremely more painful, and the pain in her back and arm were prominent again, just like when it was growing in April. Jerri felt sick to her stomach, and she said that even her liver hurt. Dr. Miller reassured Jerri that local growth didn't necessarily mean that the cancer was spreading elsewhere, but she told her that she understood the concern. As mentioned though, with this new growth, she also told Jerri to stop doing the Taxol to instead start with the combination of the CMF cocktail. Dr. Miller's goal with this was to suppress the tumor as much as they could as they worked to get Jerri out of the pole to see a surgeon, and she urged the NSF and ASA to get this evacuation organized as soon as possible, which fortunately was in the works. Jerri soon received an email by a man named Harry Mahar. Harry was the NSF's safety and health officer who was coordinating the rescue effort, and he let Jerri know that this extraction was likely to occur in about 2.5 to 3 weeks, depending on the weather in Antarctica. They were already in late September by that point, and the first flight of the season was to arrive on October 25th. So Jerri truthfully thought that maybe she should just wait until then to leave the pole. But the thing is, they let her know that with how things were looking, they needed all the possible time they could get to start really treating Jerri. Club Med was discouraged by the news of the growth, but they tried being positive for Jerri that she'd be out soon. And surely enough, on Tuesday, October 5th, Dr. Carl Erb from the NSF released a statement giving an update on the rescue effort titled Status of South Pole Medical Situation. And he gave information regarding their plans with the rescue moving forward. Club Med ended up meeting on the first Friday of the month on October 1st to start the new round of chemo with the new medications, and they ensured to monitor for any adverse reaction to these new medications. As a common theme at the pole, they had connection issues as the audio line went out, but Lisa was able to use the internet phone to call Indianapolis on another channel, and she used AOL Instant Messenger to type what they had to say into the computer instead of writing notes, which made it much easier for them to have the accurate drug doses spelled out. This session was painful to Jerri due to the lack of accessible veins. Jerri was still worried about the tumor growth, so she emailed Dr. Miller to talk in private. Dr. Miller told Jerri that there were some private things she didn't want to speak about around Club Med during the chemo session, admitting that in general she put on a more optimistic face for them during these sessions, especially during the one on October 1st. However, Dr. Miller wasn't feeling too optimistic during that session, and since Jerri truly wanted to know what the stats were looking like, she told her that her estimate of the probability of Jerri being alive and well with no breast cancer in 10 years from now was 35 to 40%. After reading this and thinking for a while, Jerri concluded, quote, I reread Kathy's words and took what hope I could from them. No proof that I had metastatic breast cancer, but a better than 60% chance I'd be dead in a decade. Well, I could try to make that decade last a lifetime. But as time went on and everyone prepped the building for the new season, Jerri started facing some more issues. Balance was becoming a problem for her. Her vision would suddenly start to spin with no warning. She was falling into walls and even got burned after falling into the stove. This left her with concerns that the cancer might have possibly been affecting her cerebellum, which is the part of the brain that controls balance. Likewise, Jerri also was experiencing chills and leg pains. These were all things she hid from everyone except from her doctor and closest friends at the pole. She continued partaking in activities, hosting brunches, and she was pushing through everything she was feeling. However, on Tuesday, October 5th, things got particularly very bad for her. While the pain in her breast and armpit area were getting better, she was so fatigued that she actually had to lie in bed at 11:22 p.m. as Big John typed a letter to Dr. Miller, as Jerri wanted Dr. Miller to know that she thinks something was very wrong with her. She described how she was not her normal self. Instead of socializing and eating, she was shaking, she was cold, she was unsteady on her feet when getting out of bed. She couldn't even function well enough to partake in brunch or watch their usual movies every night. Big John also was concerned about how lethargic she was. Dr. Miller told Jerri that while these were not unexpected side effects of chemo, they most definitely were worse than she had anticipated. That being said, she suspected it might have been due to the combination of the cumulative chemo and the long-term effects of altitude at the pole, and she emphasized that it was really important for Jerri to do the complete blood count test tomorrow on October 7th, because if her white blood cell counts were too low, then they would need to adjust the dosage of the drugs to make sure they don't fall far too low. In those next few days leading up to the rescue, scheduled for on or around the 12th, Big John helped Jerri pack to leave, and part of this included packing 3 sessions worth of chemo in case the plane were to get stranded in the middle of the ice while they were flying out. The ASA and NSF warned the pole that the media was in a frenzy again after the rescue mission was announced, and Jerri quite literally had to refuse when asked by the National Guard if an Air Force photographer would be allowed to board the plane with her. On October 6th, 2 LC-130 planes from the 109th Airlift Wing of the New York Air National Guard left the Stratton Air National Guard Base in New York State before making it to Christchurch 4 days later. This 109th Airlift Wing was the only unit in the world to have large skis on their aircraft equipped for landing on ice, and this allowed them to be the ones to conduct this rescue. The rescue crew was made up of 10 members, including medical professionals. However, 2 extra planes plus 2 extra flight crews were also there in Christchurch and in McMurdo for backup in case something went wrong. While the evacuation crew was scheduled to leave on or around the 12th, the plane was actually grounded in New Zealand until October 14th due to high winds. And once they finally left and reached McMurdo, they were grounded again as the weather began acting up. The weather needed to rise above negative 58 degrees Fahrenheit or negative 50 degrees Celsius in both McMurdo and the pole to be at minimum for a safe landing. So once it was finally all clear on October 15th, the rescue plane piloted by Major George McAllister and Dave Coulterman left and the others stayed in McMurdo as backup. The pole was updated every hour about the status of the plane. However, while the plane was on its way to the pole, it actually ended up having to turn back due to the weather. While this delayed plans slightly, it actually was great in Jerri's case because she was able to head to the party she put together for Big John's 44th birthday that evening before heading to bed due to fatigue. That next day, Big John waited with Jerri as they both anticipated the plane being boomeranged again. That was until suddenly they got an announcement from Comms Tom on the all-call that the aircraft was 30 minutes out. They quickly got on the last layers of their ECWs. Jerri hugged a goodbye and a see you later to Lisa, and with Jerri feeling too weak to walk from Biomed to the skiway, a walk she's done several times before, Big John drove a snowmobile with Jerri on the back to head over. It was a total whiteout as they drove, and it was about negative 60 degrees Fahrenheit or negative 51 Celsius, and the wind was almost at 20 knots. It was so bad, Jerri and Big John thought that the pilot would not be able to make it in this weather. But as they doubted the plane being able to make it, they suddenly heard this loud noise above the already loud howling wind. And as they listened, they realized that the noise they were hearing was that of the 4 engines of the LC-130 plane making a landing. This noise got louder and louder as the plane got closer, when suddenly they heard a boom and realized the plane was on the ground. Jerri pulled off her goggles and told Big John she wanted to look in his eyes. So Big John lifted his goggles up and they just looked at each other. No words. As the door of the plane swung open, Dr. Hugh Cohen, the arriving doctor from McMurdo, hurried down the stairs out of the plane. They didn't have time to greet one another, but Jerri was relieved to see that a new doctor had arrived at the pole, and it was a fellow Polie. Jerri wasn't the only Polie who was going to be leaving. A Polie named James Evans, who was referred to by Jerri as Pick, had actually been suffering with really bad hip pain that wasn't improving, and so he was also going to be extracted as Jerri felt he needed to see a specialist as soon as possible. To get on the plane, she would have needed to climb about 1 meter up the steps above the ice, but since this was difficult for Jerri to do on her own, Big John threw Jerri into the plane. She landed on her knees on the flight deck, and as soon as she turned to wave goodbye, Big John was already gone to the safe area to watch the plane take off. After the plane left, Big John sent a message to Jerri's loved ones titled Mission Accomplished, announcing that Jerri was successfully extracted from the pole. When Jerri landed in Christchurch, there was a mob of reporters and TV crews just waiting for her. She was fortunately picked up from the plane in a white van they called the White Rabbit, which brought her back to the back entrance of a hotel into her room. Being much closer to sea level, she just felt so much more energized by the oxygen. And even better, when she arrived at the hotel, she was greeted by her brothers, Scott and Eric, who brought hugs, kisses, and a huge plate of fruits and veggies. I'm not sure how long, but they stayed in Christchurch for just a bit. Enough time for them to be able to go to the Botanic Gardens along the Otakaro Avon River, which is something that she had dreamt about doing for months. And during the trip, they successfully avoided all media the entire time. In fact, they flew back to the US, not having to walk through an airline gate, nor having to see any other passengers until they were actually on the plane, as the NSF and ASA had arranged this so that she would be able to avoid the media. Jerri hadn't flown home to Ohio, but instead flew directly to Indianapolis, where she was met by her parents at the Indiana University Hospital. It was also there where she was met by Dr. Miller and Latrice for the first time in person, and they immediately got to work. They did a bunch of tests to see if the cancer had spread, and one by one, Dr. Miller would come in to inform Jerri she passed, getting started with the next. After a bone scan, MRI of the brain, and a CAT scan of the body, all of these came back negative, and alas, the cancer had not spread. Just the next day after arriving, Jerri soon had surgery. She had the options to either do a lumpectomy to remove the lump or a mastectomy to remove the whole breast. But in the end, she chose a lumpectomy as this would, quote, be less disfiguring than a mastectomy. Later on, Dr. Robert Goulet, the surgeon who performed the lumpectomy, called Jerri to inform her that fortunately, the cancer had not spread to her lymph nodes. Just as Dr. Miller mentioned, the day after the lumpectomy, Jerri looked to be doing fine, and she returned to Ohio to her parents' house. But while she was fine for a while, it didn't take too long when things started going downhill. Jerri started feeling severe pain in her breast, arm, and back. Not only this, but she also had a raging fever, and she was shifting in and out of delirium. Because of this, Jerri's parents brought her to their local hometown hospital, and it was there where they discovered that Jerri had a massive staph infection. So bad, in fact, she was actually near death. She had no resistance left because her immune system had been weakened, not just from being at the pole for so long, but because of the chemotherapy she was doing. And because of how bad she was looking, they actually sent her back to Indianapolis via Learjet to get treated at the Indiana hospital. At the Indiana hospital, she was put on antibiotics and pain control for 1 week. And fortunately, she did end up slowly but surely getting better. The infection had actually left permanent tissue damage in Jerri's breast and lymphatic system, and this ended up causing continuous swelling and pain in her right arm. However, Jerri had priorities on her mind, especially regarding her children. She wanted to see them and was hopeful that they would want to talk. So as soon as she was well enough to walk, she communicated with her attorney to arrange a visit with her children. The plan was going to be for her parents to drive down to pick the children up so that they could come over to the hospital, as Jerri was still recovering and was too sick to go by herself. She stated that as she tried to arrange this, her ex-husband was allegedly not for the idea. She stated that he wanted Jerri to come by herself, but after some back and forth, she was able to get some agreement on the plan for her parents to just pick them up. Her daughter was away at college, so she wasn't able to come down. So the plan was going to be for Jerri's parents to go and pick up the boys. That day, as the parents prepared to pick the boys up, they received a phone call, and when they answered, it was Jerri's sons on the phone. But this wasn't a call to confirm when they were gonna be picked up, because on this call, the boys actually told them that they were too busy that weekend, and so they wouldn't be able to come. Jerri was not able to see her children while in the hospital, and from what I can find from public sources, I'm not sure if Jerri was ever able to get in contact with them since even writing the book published in January 2001. As the public attention regarding Jerri hadn't died down, she decided she was going to be telling her own story, especially highlighting her friends who helped her at the pole. While at the pole, Big John and Jerri had even made a promise that if they were ever to write a book about her life at the pole, they would do it together. So after he left the pole around late November, he began helping Jerri organize her emails that she sent and received at the pole, as she was too sick to do so. And this was going to help her get the book written out. For 4 months straight, Jerri did very intense chemo following the operation. And this was then followed by 8 weeks of radiation, which she did at North Carolina near a beach house she'd previously bought. Soon enough, her hair was slowly growing back, darker and curlier, as Dr. Miller had predicted. Her strength was coming back, slowly, despite still feeling tired, and her attitude about cancer switched from feeling like a victim and being scared of support groups to actually wanting to speak to others in her position. Jerri made a bunch of friends with other cancer patients, and this was very helpful for her as they provided her emotional support and they also had practical suggestions for her to help with treatment. And she just gained this new outlook stating, quote, "I was living with an incurable disease, but I was living." Further stating that she did in fact find, quote, "peace along the way, peace with my disease, peace with my life, and my future." A peace she described as being facilitated by her friends, family, and community. After a few months had gone by, in April of 2000, Jerri drove to Indianapolis to do a mammogram and bone scan. And after waiting for the results, Dr. Miller delivered the great news that so far, Jerri was officially cancer-free, with Jerri stating, quote, "Only time will tell my prognosis." She felt extreme gratitude to the NSF, ASA, and the US government for everything they had done for her. And after all these months of intense treatment, she finally felt strong enough to thank those who helped her in person. She flew with her parents to McChord Air Force Base in Washington State to meet the Airdrop crew. In October, she visited the rescue crew from the 109th Airlift Wing of the New York Air National Guard, and she also kept in touch with all of her friends from the pole via phone calls and emails. Many had even visited Jerri's parents' home as well to see her and meet her family. For example, Paul or Pac had visited, and Lisa Beale had also visited and had even gone to Chemo with Jerri and spent New Year's Eve with her in Florida at her parents' winter house as Jerri recovered. Big John, after helping Jerri put the book together, actually ended up returning to California to help his mother as she had gotten very ill. And as for Jerri, she ended up moving somewhere along the coastline. And even though she did want to go back to the pole, she knew it was too risky if her cancer were to come back. However, in the winter of 2001, she actually did return to Antarctica with her parents and siblings to work as the doctor on a cruise ship, and she visited back many times after, just not the South Pole. Also in 2001, she was named Irish American of the Year by the Irish America magazine, awarded at the Top 100 award ceremonies in New York, where she actually met Bill and Hillary Clinton. On January 18th, 2001, Jerri released her bestseller book, Icebound, One Woman's Incredible Battle for Survival at the South Pole, co-written by Marianne Vollers and published by Talk Merrimack's Books. This book did extremely well, and she had many panels discussing it, including this one in Edina, Minnesota from February 23, 2001, where Jerri was featured on the C-SPAN cable and TV network series Book TV.
Thanks so much for coming. My gosh. Wow. I'm very nervous. I have to admit that I've done this every night and sometimes twice a day for the last 5 weeks. But tonight, I am so scared because of these guys. I want to warn you right now that this is not a PG lecture. And these gentlemen think that they're going to put me on C-SPAN with Newt Gingrich. Oh, dear God. We'll see.
Additionally, she was featured in a documentary TV series called When Weather Changed History, produced by the Weather Channel. Her episode aired on February 10th, 2008 during Season 1, Episode 5 of the series, titled Rescue from the South Pole. Likewise, on April 20th, 2003, a movie titled Icebound, starring actress Susan Sarandon, was first aired by CBS as an adaptation of Jerri's book. The thing with this movie, though, is that in an article published by the Globe and Mail on April 12, 2003, Jerri, who was able to watch the movie before its release on TV, described that she felt that the movie portrayed her incorrectly. She stated, quote, "I didn't like how I was portrayed because it was just too different from what I am. I'm an exuberant, happy person who's almost too funny. People say, will you quit with the jokes? So, can you imagine how I felt seeing myself that way? When I saw this shell of a gray person, it was like, what? Who is this person? I wish they would have shown me the way I really am, because it was such a happy time and my relationship with the other people on the base was so great. And even when I was dying, I was happier than I've ever been in my life. They made it look like I was stupid and everyone was teaching me. It wasn't that way. I was second in command of the station. I was one of the older ones, and I was a professional woman. I was in control. Regarding the sets of the film, Jerri did, however, state, quote, they were absolutely perfect. They had the demeanor and clothing of the police bang on. They were just so off on me that it hurt. And what's even more interesting is that in the article, Jerri further described how she had to essentially beg the director, Roger Spottiswoode, to come visit the set in Toronto. And even though he finally let up and let her visit the set, Jerri stated how when she was there, Susan Sarandon, the Oscar-winning actress who was playing her, kept her distance and didn't want to meet Jerri while there. So they had no conversation whatsoever. The only interaction they had was when Susan waved at her, and Susan too acknowledged in an interview that she didn't want to meet Jerri, but that she did know of her story and was drawn to the project because she, quote, wanted to work on Lake Simcoe. Further saying, quote, of course I knew about her. Everybody knew that there was this doctor who went to the South Pole, got cancer, and got stuck. But I wasn't interested in just doing another disease of the week kind of TV movie. What I thought was really interesting was the environment in which they existed. She did end up having to go from a person who was not exactly a team player to someone who, with great difficulty, had to ask for help from someone else. And I obviously don't personally know Jerri at all, but even just from reading her book, seeing the clips from the Weather Channel documentary, seeing clips of her speaking, and even seeing the actual emails she sent to people during her time at the pole, she definitely did seem like a much different person in contrast to how she was portrayed in the movie. In real life, she was cracking jokes in her emails and even in her talks, but then in the movie, her character just seemed kind of dull, almost like she was annoyed with everyone and everything and didn't want to be there. I obviously don't know her in real life. That's just based on the little knowledge I have from researching this case, but if you are able to read the book and watch the movie, I think you'll see what I'm talking about. Now, in a turn of events, almost a year after Jerri released her book, on December 31st, 2001, a lawsuit was filed by Jerri's ex-husband, Jay, who sued her, alleging defamation regarding the things she wrote about him in her book. This lawsuit included both Jerri and the publisher of her book, Talk Merrimack's Books, and he was seeking $1 to $5 million in damages. In this suit, he alleged that Jerri had included false information and personal attacks toward him in both the book and in media interviews promoting the book. According to a Toledo Blade article from January 10th, 2002, the suit alleges the following, quote, Jerri did not limit her interviews and biography to legitimate subjects of personal interest, such as her struggle with breast cancer or her experience at the South Pole. Rather, Jerri included false and defamatory depictions of Jay. These false publications damaged Jay significantly, further claiming that the publicity and media attention surrounding the allegations resulted in, quote, a significant number of patient cancellations in his medical practice. These allegations most notably referred to the claims written in the book of emotional abuse against Jerri and even physical abuse against their children, specifically referring to claims that her ex-husband allegedly took the life of a dog in front of Jerri and their daughter, that he denied Jerri from visiting their children, and that he purposely isolated the children from Jerri. And regarding the publisher, Talk Merrimack's Books, the suit alleged that the publisher, quote, failed to properly investigate and edit the allegations made by Jerri. At the very least, these defendants acted negligently towards Jay, toward his right of privacy, and toward his reputation. Nonetheless, They eventually settled the lawsuit outside of court. And with this settlement, Jerri was unable to speak about her ex-husband nor her children. So since then, you'll see online, there's not many updates regarding them. Jerri went on to become a motivational speaker, doing many talks sharing her story. She went on to several medical schools spreading words of wisdom to future doctors, and she also continued working as an emergency medicine physician at various hospitals in the Northeast. Not just this, but she also went on to travel the world, as mentioned, to Antarctica and even to places like Mongolia, for example. Likewise, she eventually fell in love and remarried to a man named Thomas, or Tom Fitzgerald, who she actually met 20 years prior while they both were on vacation in the Amazon around 1986. They moved to a house in Southwick, Massachusetts. Unfortunately, after being in remission for 5 years, the cancer had returned in August 2005. Still, through chemotherapy, Jerri continued with doing talks. A scholarship was even created in her name called the Jerri Nielsen Scholarship. This scholarship was created in 2008 by two medical students, Andrew Nyberg and Brooke Johnson, at the University of Toledo, which is the current name for the school Jerri graduated from in 1977 when it was called the Medical College of Ohio, or MCO. And this award was to be given to graduating medical students. I'm not sure how long they were able to continue doing the scholarship for, but I couldn't find much on how it's going today. On October 17, 2008, Jerri was honored with this scholarship after sharing her story and presenting a motivational message to an audience of 175 medical students at the University of Toledo's College of Medicine. In part of the talk, Jerri stated, quote, "There is no end to your life until your last breath. We can all do something for someone. It doesn't matter how or when you die. The only thing that matters is, did you ever live? Did you? I know the people in this room have and will." Shortly after stating this part, Jerri removed her wig to show her bald head, indicating that the cancer had returned and that she had been doing treatment. And it was during this talk when many would learn that Jerri had suffered a stroke just 2 weeks prior to speaking that day. Eventually, the cancer had spread to Jerri's liver, bones, and ultimately to her brain. And just a few months later, on Tuesday, June 23rd, 2009, Jerri passed away at the age of 57 in her home in Southwick, Massachusetts. In her obituary, her husband, Tom, described her saying, quote, "She fought bravely, she was able to make the best of what life and circumstance gave her, and she had the most resilience I have ever seen in anyone. She fought hard and she fought valiantly." Jerri has such a powerful and inspirational story. I think it really just highlights the importance of perspective and being able to find meaning and purpose even when dealing with very difficult things. She was feeling very down about a lot of things in her life, but when she got that switch that made her realize that she still has a lot of life to live and things she wanted to do, she went full throttle on living her life according to that. And I'm really glad she shared her story in her book and documentaries and talks, because being able to get her firsthand account on everything that happened just really emphasized this message. Jerri's legacy will continue to live on with the messages she's shared, and her story should hopefully provide some inspiration for others. And I think a huge highlight should also go towards everyone who made this possible, being Dr. Miller, the Polies, her family, and very notably, the Airdrop crew and the rescue team. They risked their lives to fly in dangerous conditions to go help Jerri, and what they did was truly commendable. And Jerri wanted a major takeaway from her story being the power of friendship and communication, stating, quote, "The point is that a person can change their life simply by deciding that they want to make a change in their life. The poll taught me people can tolerate so much more than they believe they can, particularly if they have people who care about them, then they can overcome anything." But yes, that is it for this case. What are your thoughts on Jerri's story? What do you think about her time in the South Pole? What do you think about the press? Did any moment in particular stand out to you? Please comment your thoughts below, and don't forget to subscribe so you don't miss any other videos on medical cases, crime, and mysteries. Bye now.